Hello, good morning, good afternoon, good evening for some of you, and welcome to day three of the Global Nutrition Global event. We're very happy to have you all here. My name is Iris Bollemeyer. I'm a senior nutrition advisor working for International Medical Corps. And together with Ruben, we will be your moderators for today. Ruben, would you like to introduce yourself, please?
Hello, everyone. Welcome. My name is Ruben Sanchez, Nutrition Cluster Coordinator for the Venezuelan Humanitarian Response.
So we have a very busy day today, as of the same with Monday and Tuesday. So we will open another box of chocolate for all of you today. I hope you're excited for this last day of the global event. Before we will dive into our box of chocolate and before we have exciting sessions, we would like to recap what was discussed yesterday. So, Ruben, would you like to start?
Yes, of course. Yesterday was a really nutritious day. We start fresh in the morning here in Venezuela with an interesting discussion on how the geographic tools can support the response and improve the efficiency of the programs. And then we jump right into the importance of mental health and the support to mothers in the mommy program worldwide. This strategy is vital and have better results, and it's a great opportunity for research, and we can create more baselines into this. What do you think about these sessions, Iris?
Yeah, I thought it was super interesting as well, Ruben. I really enjoyed it. And I also really enjoyed the session that came afterwards about the wasting management. I think we all had such rich discussions. So we had actually two, and I've only been able to join one. And that breakout session was really about community-focused interventions, looking at ICCM Plus and health community health workers. And it showed that these approaches can be as effective as traditional approaches. And I think, especially in times like these, when there's a lot of financial uncertainty and we need to do a lot more with less funding, having cost-effective programming, I think it's really key. Do you agree?
Yes, sure. And was really interested. And then hearing this lighting talk on how to simplify the creation of menus and the distribution of money for families, school feeding programs, and having more nutritious meal for children's, and how this tool can do this automatically was really good.
Yeah, I thought that was an excellent session indeed. And the one that followed after on the infant feeding in emergency, we kind of learned how to use new technology and digital tools, how that can support emergencies and have real-time guidance for breastfeeding interventions. And we also had a great presentation on the IYCF assessment tool. And I think this tool can really streamline the IYCF assessments, and we can compare IYCF status across time, over time, but also across different contexts. And one of the presentations I think got also a lot of traction is about how we can engage fathers in IYCF practices, and that you can really make a difference, and we can really have a transitional moment when using fathers.
Yes, was a very touching and important moment to see all the programs that are researching on this. And we end up the day with a NIS great session, and we see how the importance to evolve our data collection, to improve our data collection, how we can use more and adapt the approaches using AI that is on the moment, and we need to adapt to this. And also the importance of qualitative data, sorry, especially for the design, finding the adaptation of programs. And ACF share a new tool for rapid NDA that was really, I think, will be really useful for all the interventions across the world.
Yeah, so yesterday was a fantastic day, and I hope you'll do that today as well. We have a very packed agenda for you, so if you can go to the next slide, please. So today we will have four sessions. The first one will be about anti-racism and localization. That would be a very interesting, and we already discussed about localization a little bit in the previous days. So I'm very curious to see where this would take us. We also have a dedicated session about climate and how to integrate climate resilience and resistance into our nutrition work. Next slide, please. Then we'll have a presentation about the people-centered approach to nutrition in emergencies. This will include a lightning talk, but also two plenary sessions. And we will have a final session about the Global Nutrition Cluster strategy development. There has been a lot of work already done about the strategy development, but we really would like to engage with all of you to make sure that all the voices are heard and incorporated into the strategy. And then we'll close the meeting with closing remarks from Andrew and from Stefano. So another packed day for all of you, but I'm excited for today. Next slide, please. So we'll go over some ground rules, and I would like to invite Shana to discuss a little bit on how to moderate or use the Zoom. So Shana, over to you, please.
Thank you. And hi, everyone. If you've been joining us for the last couple of days, this will be a review. But if you've just been able to join us today, welcome. We are offering live interpretation today in French, Spanish, and Arabic. To use this, you'll click the interpretation icon. And yes, there we go. On the slide, you'll see it looks like a little globe at the bottom. If you don't see that, then you'll click on the circle with the three dots that says More, navigate to Interpretation, and select your language. We highly recommend that you mute the original audio, otherwise you will hear the speaker in the background, which could be distracting. If you are listening in English, we still encourage you to select the English language channel, as some speakers will be presenting in other languages. Every once in a while, there is a lag time between that switch, so it should be okay. Just give it a minute and hopefully it will kick in quickly. Presenters, please remember to speak slowly and clearly so that the interpreters can follow you while you're presenting. The interpreters may let us know if they are having trouble following you, and the daily moderator may gently interrupt you to speak up or speak more slowly. So just a warning that that may happen, but it is to make sure that everyone can follow along as best as possible. Closed captions are available. There is a CC button also at the bottom of your screen or in the More menu options. You can choose from a number of languages and show captions, but please note that these are auto-generated captions. There are 6 of us from JSI who are supporting you this week. We have tech support in our name, so if you have an issue with anything, you can look in the participant list, find who has tech support, click on that, and you can send us a message directly, and we will do our best to help you. I think many of you are already using the chat box to introduce yourselves. That's wonderful. Please keep doing it. Keep commenting on the great things you're hearing in the presentations. When we have our Q&A sessions, there will be the Q&A box, which once again will either be at the bottom of your screen or in that circle with the 3 dots, option, more option to find that. So, and as we're learning Zoom, if you don't have a full screen and not all the options are available to you at the bottom, it will show you the ones you've used most frequently. So even if it was at the bottom of your screen at one point, you may have to go into More again to either find the interpretation or the Q&A box. If you are not presenting, please stay on mute and with your camera off. As we've mentioned, there will be opportunities to interact in the chat, in breakout rooms, and in networking sessions, so you will have opportunities to speak with and see each other. And lastly, this event is being recorded and will be available later for those who either could not attend or if there are sessions that you want to revisit, that will be available to you on the event website. Thank you so much.
Great, thank you so much. And thanks for the whole JSI team. Their support has been incredible. There's a lot of going on in the vaccine. So now we would like to go to our first session, and we will have two session leads. So Martha is one of them. She is a public health nutritionist with over 13 years of experiencing in nutrition programming in emergency and non-emergency settings. She is a CMED advisor within the operational team for the GNC and is hosted by International Medical Corps. She is also the co-chair of the GNC Anti-Racism and Localization Working Group. Together with Marta, Dr. Hiba will be the session lead. She is a Yemeni humanitarian professional with over 7 years of experience in humanitarian healthcare and nutrition interventions. Currently, she serves as a nutrition program manager at Building Foundations for Development. This is a national NGO in Yemen. She played a coordinating role as a subnational nutrition cluster coordinator and is also a member of the GNC Anti-Racism and Localization Working Group. So Martha and Dr. Hiba, over to you, please.
Thank you, Aris, and many thanks to those who attend today. Hope my voice is clear, and thank you for starting this day. To everyone, no matter where you join us today, whether it's the start of your day, the end, or somewhere in between, a heartfelt welcome to our session today. We're very delighted to have you all here. And on the behalf of the GNC, thank you for making the time to attend today. Join with my colleagues, Martha, we are going to be the session lead for the 10th session about localization and anti-racism. And I hope that a diverse stakeholders from across the globe are joining us today and to be able to engage in such important and transformative shift in the humanitarian nutrition sector, and where we are doing walk the talk and in promoting equality, justice, and meaningful local leadership. Let me walk you through the agenda for this session today. We're going to discuss 3 main segments. First, we will hear from our colleagues about the GNC localization roadmap. Where are we at? What are the action? What is the progress? What are the challenges? And we move forward. The second segment is going to be a discussion from 2 local NGOs from Sudan. They will share their first-hand experiences in shifting power dynamics about a project implemented by the GNC and their support that was received to multiple NGOs. And finally, we're going to move into depth discussions and language and power and nutrition in emergency settings. So please stay engaged throughout the session and discussions. Your contribution and insight are very important and very vital to our discussions today. We are very grateful to be part of this journey, and we encourage you all to stay engaged throughout this session by inboxing anything in your mind in the chat. Of course, we will have a Q&A, short Q&A at the end of this session, where we're going to hear from you directly. My name is Dr. Hiba. I work as Nutrition Program Manager with BFD, a local NGO in Yemen. And I'll give the floor for my colleague, Martha, to introduce herself and start the first session. Martha, over to you.
Thank you, Dr. Hiba. I think I'll not take time introducing myself. I have already been introduced. Today in the capacity as the co-chair for the Anti-Racism and Localization Working Group. And just to emphasize that today we're really looking at our enabling environment as the GNC. You can already see the speakers we'll be having today. Alexa will come in just soon after to give us the progress update on where we are with our roadmap. And there's quite some interesting insights along with support from Dennis, who is our localization subject matter specialist. And then Ali and Danielle, we were gladly waiting to hear from you talk about your shifting experiences. Ali and Danielle's organizations have been part of the GNC localization project that we've been doing, and we would really love to hear from them. What has changed? What has shifted? What has been better? And then Sona. Colleen is not going to be able to join us due to some challenges. So Alexa and Sona will be taking us through the language's power. What words are we using? What phrases, what expressions, and what should we change and how should we be better? Slide. And then with that, I'll hand over to you, Alexa and Dennis, to take us through the roadmap and where we are so far with this roadmap. Thank you.
Thank you very much.
Thank you so much, Hiba and Martha, for kicking us off. My name is Alexa or Alexandra Humphreys. I am joining the session in my capacity as the Localization Help Desk for the GNC. In April of last year, of 2024, we launched the GNC Localization Roadmap. This was a concerted effort to map what the GNC has been doing to further localization and what steps we imagine we need to take next. Dennis, do you want to come in and introduce yourself before I continue?
Thanks, Alexa. My name is Dennis Kioko, supporting the Global Cluster Coordination section in UNICEF on localization and working very closely also with Alexa and the GNC team to accelerate localization in GNC. Thank you.
Great, thanks so much, Dennis. Next slide, please. So the objectives of this roadmap were to summarize ongoing efforts by the GNC to contribute to localization, to chart a way forward in how we can foster a more enabling environment for localization. And this ended up being taking the shape of 42 co-created activities. It was also developed to complement the GNC 2022-2025 strategy, because although localization is important and mentioned, we needed more of the how. And this also articulates the GNC's theory of change around localization. This theory of change is presented here visually, but just briefly to go over it, it's based in the belief that if the GNC recognizes and strengthens the technical and institutional capacities of local and national actors, and this includes national and subnational authorities, and if we're also enabling their participation, their representation, and their leadership in humanitarian coordination, and very importantly, decision-making spaces, then we believe that we can continue advocating to increase their funding and equal partnerships, international actors, with international actors, and that this is going to increase local and national actor visibility, and increase how locally led responses are, and to ensure that support is quality, timely, and contextualized to best serve the affected populations. Next slide, please. I mentioned that the localization roadmap contains 42 activities. We don't have time to go through all of those today with our very rich selection of presentations, our box of chocolates today, but I'm just going to provide an overview of where we are in terms of the status of these activities, and then I will provide a couple specific examples. So of these 42 activities, 48%, so nearly half of these activities have been initiated, but they do require more efforts and resources to be fully realized or on track. 14% of the activities are on track, so on these we are making good and steady progress. 19% are completed, so we consider that we have achieved them as we had set out to do in the roadmap. And 19% had no progress due to various challenges and barriers, some of which we will look at in a moment. The roadmap itself is intended to cover from January 1st, 2024 till December 31st, 2025, so it says 2 years. As we're halfway through 2025, it would be ideal to see about 75% of the activities either on track or completed, but this number combined is just 33%. So overall, I would say that we are off track to achieve the majority of these activities by the end of the year, end of this year. but all is not lost because those that we are achieving, we feel are still of value. Next slide, please. Going to briefly look at 3 examples of activities we would consider to be quite successful. Activity 15 was around hosting a series of introductory conversations with local and national actors in GNC countries. We held these calls with local and national partners in Afghanistan, Northeast Nigeria, in Myanmar, and they led to some new questions and some requests for technical support. Some of the next steps we could take with these would be establishing global spaces for local and national partners to exchange experiences and strategies, because this was a request that came out of those engagements. Activity 22 was around supporting the development and rollout of an inter-cluster localization e-learning module. This is now available on Agora, and we did incorporate it as part of the annual anti-racism and localization training last year for the GNC. And activity 26 was about adding a dedicated section on localization to the GNC communications guide to translate this into
Alexa,
action.
is the
Yeah.
request that you should slow down a little bit from the translators?
No problem. Thanks for letting me know, Martha. So for activity 26, in order to translate this into action, we need to do a better job of writing more about the excellent work that local and national actors are doing, just highlighting their good work. Next slide, please. And I'm going to hand over to Dennis for the next part. Dennis, how would you say the nutrition sector is doing in terms of participation, leadership, and direct funding to local and national actors? And how do we envision the humanitarian reset could influence future localization progress? Over to you, Dennis.
Thanks, Alexa. And maybe just to start us off with the current humanitarian reset discussion and humanitarian reform, there has been a shift or an emphasis on locally led humanitarian coordination and action. And this really is coming at a great time when we are also having the GNC annual meeting to share the collective efforts that the GNC partners, donors, and local and national actors have been able to achieve in increasing participation, representation, and leadership of local and national actors in nutrition in emergency coordination mechanisms. When you look at these graphs, and this is data as of 2025, you see that in nutrition, 41.53% of local and national actors are members of the nutrition cluster, and this is data at the global level. We also see that the nutrition clusters have really incorporated local and national actors within their respective strategic advisory groups. We see that 100% of nutrition clusters at the country level have members, local and national actors as members. The other bit is also looking at the leadership, and when we talk about leadership, we look at both national and subnational. At the national level, we see that local and national actors comprise of 87% of nutrition clusters are either led or co-led by local and national actors. And at the subnational level, and this is an area that probably we need to continue to explore, how can we strengthen that? We see that at the subnational level, the leadership or co-leadership by local and national actors stands at 26%. The last figure is really looking at the funding, and in line with the current grant per gain target of 25%, we are not yet there. I see that we are, as of 2023, direct funding to local and national actors in nutrition sector was only 2.4%. So really meaning that we really need to explore how can we work together to increase these figures. I'll hand it over back to Alexa. Many thanks.
Thanks, Dennis, for walking us through that. Next slide, please, and for connecting it to the current humanitarian reset conversations. Really quickly on challenges. I believe that in order to address challenges, we need to be very honest about them. There have been some overarching challenges that we continue to face, trying to take localization from a buzzword to an actioned approach. First, there are innate challenges of trying to reform a system that was built for UN agencies and international actors. So we're kind of swimming against the current. Second, we frequently see confusion about what localization is. Sometimes instead of thinking of it as shifting power from international actors to local and national actors, there can be confusion with nationalization, which is international agencies or organizations hiring more national staff or allowing them to fill higher positions, but it's not the same thing. Third, there are strong power imbalances embedded in the humanitarian sector that are going to take sustained efforts to address. And lastly, this year was an especially tumultuous period for everyone, but this did cause some activities in the roadmap to sort of stall or be deprioritized, but we hope they will pick back up as the dust settles. Dennis, I think we need to wrap up, but any last thoughts on challenges from your perspective?
Yeah, I suppose another key challenge that we've seen is the drastic funding cuts that the current humanitarian sector is currently facing, and in line with also the recent ALNAP report on the state of humanitarian affairs, we see that direct funding to local and national actors really dropped from from 2023 to 2024, and the prediction is that this might still really struggle forward in 2025 and 2026. So that's a big challenge that we need to be able to discuss on how we can go about that. Thanks, Alexa.
Thank you both, Alexa and Dennis, for this thoughtful and comprehensive update on the localization activity. It's very encouraging to see the tangible progress of the 90% completed activities and giving us some examples of the completed ones. And also thank you for the honesty of sharing the challenges, but I believe that with a sustainable collaboration and commitment, we can do further change. With no further ado, let's go to our second segment. As I mentioned earlier, as part of the GNC effort to promote localization, GNC has implemented a project in 3 countries, Sudan, Somalia, and Mali, that was aiming to provide a targeted capacity strengthening to national NGOs. This project focused on 2 main areas about strengthening the organizational capacity and enhancing technical competencies. In each country, this project was engaging from 4 to 5 local NGOs through a tailored support and collaboration. In this segment, we are very pleased to hear from 2 representatives from 2 Sudanese organizations who will share their experience about shifting powers. I'm pleased to give the floor to Ali from Darfur Community Development to briefly introduce himself and to give us highlights on his journey. And Ali, please, you have 5 minutes to give us a summary and highlight on the shifting powers for your experience. Over to you, Ali.
Ali from Darfur Community Development. It's like a national organization working in Sudan in different sectors, and especially for nutrition sector. Since the onset of this crisis in Sudan in April 2023, the power of the humanitarian response and the coordination and the leadership and implementation really become a difference. And as DCD, since that time, we started the coordination at the local level, especially in West Darfur. Through that process, DCD have led the steering committee of local NGOs, and we working very, very hard to communicate even with the national and UN agencies, and to make like an assessment in different localities in West Darfur. Through that, we able to provide an information to all actors, especially for the nutrition clusters. And yes, through our engagement with the GNC program, DCD have revised their objectives and their approach, and from that time, DCD become one of the big player in West Darfur in the nutrition cluster, and now DCD is running a lot of project for nutrition. Also, in August, DCD led like a critical nutrition assessment in Guinea, and it was like as before in 2023 as the first local NGO to carry out an assessment and to provide like information to the all actors. So the shifting power from the international agencies to local NGOs, it is not an easy, but through the experience and also through the capacity that we gain from the GNC, we able to conduct another assessment in Guinea, and also making like information to be available for all actors. Also, DCD, for the shifting power, now DCD led or leading the national health cluster co-coordinator in West Darfur, and also this is coordinating all the effort of the health actions as well as the nutrition. Beside DCD also, now DCD is the only one national organization in West Darfur, because after
Sorry,
MSF,
Ali, we've lost you a little bit.
Now this has become a big player for the localization. Yes, this is, I think, in brief, how DCD able to shift the power from the UN agencies as well as from the international organizations, and how DCD play a role in the coordination mechanism and in the fundraising and also in the advocacy. This is, I think, in brief about the yeah.
Thank you, Ali. Thank you so much for sharing the changes that was very tangible and valuable, for sharing your valuable insight. We're very glad to hear that there are some activities that has been changing and you're advancing beyond even nutrition sectors and in the organizational capacity for DCD. I'm now very pleased to welcome Daniel Chokka from Peace Organization for Rural Development. We look forward to hearing from you about the organizational journey and the practical aspect of shifting powers. You have 5 minutes, and I'm really sorry, but we have to go through the line and timeline. Daniel,
First,
go ahead.
thank you
The
so
floor is
much.
yours.
Thank you so much, colleagues. Thank you, Alexa. Thank you, all the colleagues in this forum. My name is Daniel Choka. I am Programs Coordinator for Peace Organization for Rural Development. I'm a national humanitarian organization working in Sudan, across Sudan, and basically more deeper in West Darfur. First of all, I will be taking you through two aspects that have shifted in our site regarding our interaction with GNC. One, I'll be taking you through shift in governance within our structure, and then the other one, I'll be taking you through the partnerships that we had, and then the expansions that happened after the training. At Peace Organization for Rural Development, our experience with the NGC training has truly been transformative. The training provided us with the valuable tools and insights that have strengthened our governance structure, and then making our processes more transparent and accountable. Given the interaction that we had with the NGC, we managed to hire more experienced staff within our programs. We managed to hire one expert, which was which is now a program manager, taking over much more role from the executive director, and also
Daniel, we're losing you. Daniel, can you hear us?
Hiba, I think we've lost Daniel. I don't know if his colleague can come on and support
Thank you so much.
us.
I'm available here, Babikir. Instead of the Daniel, maybe he lose his internet. And
Thank you, Babikir. You could just maybe give us a brief snapshot in 2 to 3 minutes. Thank you.
okay, thank you. This is so much. I'm appreciating this, Babikir Adam Sharif. I'm the executive director for the Peace Organization for Rural Development. So now, already my colleague Daniel, he mentioned that's our change in our organization, and also now we are recruiting for the international staff. Currently now is progressed and approved. And also we have like in the West Darfur, currently we're operating in a small project with the health and nutrition with concern. And then also we have another health and nutrition in the east of the Sudan, currently also implemented with WFP and MPI. So just we are playing a critical role for the steering our organizations, guiding, as he mentioned here, day by day, and the programming, also the financial operation. The final thing is that when we have also opening our organization like the international in Kampala. So will be next year, we both can be the international organization under the processing now. The second thing that is strategic, our partner with the UNICEF for the education and WASH on the mid-air, also in a WASH on MPC, and the concern medical team, international medical team, and the cash consortium also now we are undergoing. The final thing, the SHF, where the cross-checking is final stage in assessment, and maybe it's going to approve for direct receive the funding from ACHF after the 6 months. So also our board activities in other states like Gadarif, Kassala, Al-Jazeera, Khartoum, Damazin also is not mentioned, and White Nile. So these were the extended this year in Eastern Sudan, some of them in North and the South Sudan. Thank you so much.
Thank you, Babikir. Thank you. And I'm glad to see how, with this support and engagement, local partners are coming on board to take up most of the work. Happy to see DCD having done CMARM, including stabilization centers, or the only SC in El Geneina. POD even now trying to move on and expand boundaries and become international. We wish to see more of that and more shift of power and resources. And what better way to get into our final part of the session, which is language is power. What should we shift? What words should we use? I see someone has asked, how can we redefine localization? And I think this would be the best opportunity to start these discussions. Over to you, Sona and Alexa.
Thank you so much.
धन्यवाद माता, आप सभी का इस अगले सत्र में स्वागत है। लेकिन अगर मैं इसी भाषा में बोलती रही तो आप में से शायद ही कोई मुझे सुनेंगे। Don't worry, there's nothing wrong with the interpretation. There's no glitch here. All I was saying is thank you, Martha, and welcome to the next part of the session. But if I continue to speak in this language, which is in Hindi, I would lose most of you. And that's just one aspect of the power of language. Even when we speak in a common language, we may use jargon or terms and phrases that may not be understood by many. However, what we are touching upon today is language within the nutrition and emergencies programming that can either empower or disempower a person. And we will together think through to identify language that needs to be avoided or included in the NIE sector. Can we go to the next slide, please? Okay, first, let's look at the compelling and practical resources that the Anti-Racism and Localization Working Group has produced, even if we may say so ourselves. There have been numerous case studies and articles, such as one on the importance of prioritizing local expertise, which are available on the website. The ANL Working Group, or the Anti-Racism and Localization Working Group, has initiated a community of practice that meets once in 2 months, where we have thematic discussions relevant to anti-racism and localization, such as linguistic inequality, passport privilege, whose expertise is valued, and so on. And the key takeaways from every thematic discussion are documented and available on the website. And as pictures speak louder than words, an image use guidance has also been developed in collaboration with other GNC working groups. And a quick resource guide for GNC anti-racism and localization in NIE is coming soon. Can we go to the next slide, please? So some of the upcoming work from the ANL working group includes an article on the climate benefits of prioritizing national and regional expertise. And the community of practice discussions will continue every 2 months, and there will be more thematic takeaways from these. And every year, GNC hosts an online training, which is open to all GNC, including the working groups and members. And so in 2025, there will be one identified as well, which will be shared. And the training will take place, and there are discussions that happen based on the training as well. There will also be a GNC language guide for which we would appreciate inputs from all of you. Let's start thinking now. What needs to shift in the language that we currently use in the NIE sector? And to facilitate this thinking, I will now hand over to my colleague Alexa for the next part.
Thank you so much, Sona. I hope everyone can hear me loud and clear. Now that you have got us thinking critically about language and shared that we aim to work on language on a sort of like language or terminology guide to support the GNC, I'm going to facilitate 2 polls so we can learn from the audience today. your thoughts on language. So I'm just going to open this up real quick. Make sure I can share my screen. Yes. We're going to be using Mentimeter. And sorry, I just need to make sure this is presenting in the way I want to see it. Okay, great. Colleagues, we are going to be using Menti. So use your phone, use your computer, go to menti.com, that is menti.com, and use the code at the top of your screen, 55567103. The question we're asking first, the first poll, is what words or expressions do you think or feel are problematic or we should phase out in our sector? This could be a word or a phrase that you hear commonly in our work in our sector, and it kind of bothers you a little bit and you wish that we were using a different term. We would love to hear about those terms and those words and those phrases now. So encouraging everyone on the call to go to menti.com and use the code 55567103. If for any reason you're not able to use the Menti, you can also put your comment in the chat. We really appreciate this feedback as we are getting ready to start the process of developing sort of a language or terminology guide. Anything you tell us today gives us something to explore and explore. What are the power dynamics related to these terms? Are there terms that we should be using that are better, that we can be, kind of recommending as maybe a good movement forward? So seeing some results coming in. We saw a mention about field as in field work, localization was mentioned a couple times, system strengthening, beneficiaries, I would add that one myself as well, triple nexus, global south or third world, like to shift to global majority, wet nursing, third world, nexus. Keep them coming in. I'm only going to keep this, in the interest of time, I'm just going to keep this poll open for maybe one more minute. So please keep your comments coming in. This is really interesting and it's giving us a great starting point in what to explore for this guide. Decolonization, wasting, a couple more for beneficiary, lactating, capacity building. We saw third world again, third world a couple times, less developed countries. These are great, colleagues. I really appreciate all of these insights. Maybe 30 more seconds. Keep them coming. If I shift, and you didn't have time to enter, you can also put them in the chat. The poll is just nice though, because it's anonymous. Resilient, I saw resilience before. Anti-racism, first person language. Thanks, Martha. I'm going to take us now to the next poll. Ready, set, get your last responses in. Okay, next poll. We are now asking the opposite question. What words or expressions do you think are helpful or that we should embrace more in our sector? This is a little bit asking, doesn't have to directly respond to what you put in the first poll, but this is a bit asking what we should mention more. What is empowering language? What is useful language? What is inclusive? Yeah. Or even you could think about words or terms that are used in other sectors, even outside of the humanitarian sector, that you feel like look at timing, that you feel like we could adopt in our sector. So this one is very open as well. Also great insight to set us on course or give us some things to explore for the language or terminology guide. Great, keep them coming, colleagues. I'm going to hand back over to Hiba and Martha in the interest of time. Thank you so much. I'll leave the poll up while you're closing us out though, so folks can still enter responses. Thanks.
Thank you, Alexa. Thank you, Sona, for this great session of collecting ideas and discussing about language's power. As we come to the close of this very powerful and thought-provoking session, I want to remind us all that localization and anti-racism is not just a theme. And today is just a proof that GNC is committed to the required action and reflection and collective efforts. The voices that we hear today, are especially from our colleagues in Sudan, showed us that how can shifting powers look like? So many thanks to all speakers who have contributed today. Unfortunately, in the interest of time, we don't have a time to allocate for the Q&A, and I'm really sorry for this. However, all your questions that was put in the chat will be addressed. Thank you so much, and let's keep carrying this momentum forward. Thank you again, and I hope that you enjoyed our session, and good luck with the upcoming sessions today. Over to you, Iris.
Thank you so much, colleagues. You can put all your questions on the Q&A box, and the colleagues will answer and will reach out to you for any other doubt that you have. Now, if we can go to the next part, we're going to a split part. We're having a lightning talk about useful IYCF in emergency resources with Rachel Meneses. And we will have also the networking session. And for those who want to have a coffee break, you can have a coffee break, but also you can come and have an option for viewing the posters while you are having the coffee break. So we will see you all in 10 minutes, and thank you.
Hi everyone, thank you for joining this session. My name is Rachel Menezes from the Emergency Nutrition Network, and I'm going to take this opportunity to give you a quick overview of our key infant feeding and emergencies core group resources and materials. So we'll start with our main resource, that is our operational guidance on infant and young child feeding in emergencies. And this was most recently updated in October 2017. And was developed to provide concise, practical guidance on how to ensure appropriate infant and young child feeding in emergencies. So the operational guidance is aimed at policymakers, decision makers, and programmers working in emergency preparedness and response. And that includes governments, UN agencies, national and international NGOs, donors, volunteer groups, and the private business sector. So anyone who's working with infants 0 to 23 months old in emergencies. So if you fall into any of these categories, you're probably already familiar with this resource, but if not, definitely scan the QR code to check out the guidance. Next, we have our IYCFE infographic series. These are really practical, concise, and simple infographics that were developed to explain some of our key IYCFE topics that are explored in the operational guidance, which I just shared on the previous slide. So if you are an emergency practitioner or program manager and you work with infants 0 to 23 months, you can utilize and share infographic series, and they're really simple resources to support you in emergency context. On the screen, you see a list of infographics that have already been developed and languages that are translated to you. Please do us if you request in language not listed, but these simple resources you can use there.
Hi, the sound is breaking up.
Is a newly published technical note that really highlights the importance of breastfeeding and that it is a life-saving practice. And this is a great piece that can be used to advocate for infant feeding in emergencies and to uphold safe and appropriate IYCFE practices. So you can check that out by scanning the QR code there. We also have a great package of 3 key resources for our media and comms folk. We realize that a lot of media and communication experts are reporting on emergencies and reporting on infant feeding in these contexts, but they don't necessarily have the technical nutritional health background to be able to accurately report on some of those key IYCFE messages. So this is something that was highlighted to us a couple of years ago. And as a result, the IFE core group hosted a webinar to share key IYCFE messages and practices for the media. And these can be used when reporting on emergencies that affect infants under 2 years old. And then after that, these 3 resources were developed to aid media experts so that we can avoid inappropriate messages or images and rather promote good IYCFE practices. Another couple of recently published pieces are around Mpox, monkeypox, and our frequently asked questions document, as well as our joint statement and template. So the frequently asked questions reflect the available evidence regarding the transmission risks of Mpox virus through breast milk and breastfeeding, the protective effects of breast milk and breastfeeding, and the harmful effects of inappropriate use of breast milk substitutes. So this is a useful resource to help provide answers to health workers and the public, including mothers who are breastfeeding or expressing milk, on breastfeeding during an Mpox outbreak. We our CF global outbreak. We also have our IYCFE Hub, which is a global portal to the most relevant and trusted resources related to infant and young child nutrition in humanitarian contexts. So the resources on the IYCFE Hub include guidance, protocols, all sorts of tools and education materials. It's a really great collection of all of the best resources on IYCFE, so definitely check out the IYCFE Hub by scanning the QR code. The final resource to share is our NNET forum on infant and young child feeding interventions. So NNET is a free and open online community forum where nutrition practitioners can access technical advice for any challenges they're facing. And this forum is a great place where you can ask questions, discuss anything with peers. So definitely check out our NNET forum for the most recent discussions. And please do create an account on NNET and post if you have any questions, if you wanted to share any particular resources or call for support. Last, create an account on NNET and post if you have any questions, if you wanted to share any particular resources or call for support. Lastly, we want to bring your attention to a few pieces that are in the works. So to whet your appetite a bit, we want to share that we have our IYCFE and cholera frequently asked questions and 2 infographics, one on supporting wet nursing in emergencies and one on supporting relactation in emergencies that are all in development. The wet nursing infographic is the closest to being finalized and published, so please keep an eye out for this resource. And if you want to chat to us, please send us an email on the screen. You can see our email listed there, or scan the QR code to view our website. So we hope you find these resources helpful for your work, and thank you so much for listening.
That was a very interesting presentation. Thanks so much. So now we are going to our next session on climate change. I hope you enjoyed the talk or had a good cup of coffee or did some networking. But as I said, we're going on to the next session about climate change. And I would like to introduce the session lead to you, which is Domitille. Domitille is a nutrition, resilience, and climate expert with the WFP, and she has served as a co-chair of the Climate Crisis Working Group. She brings over 20 years of experience supporting the integration of nutrition into programs and policies related to resilience, food systems, and climate. Domitille, over to you, please. Domitille, are you there?
Yes, I
Okay,
am.
great.
Okay.
Great, over to you.
Hi everyone. So thanks for the introduction. So welcome to this climate session. So we will have a 45 minutes to speak about the work of the climate working group, and I also listen to two presentations from colleagues on how they have looked at integrating nutrition into anticipatory action. Next slide. So as I said, so we will start the first segment with this presentation from the climate crisis working group to present a bit the way we have looked at this agenda and provide an overview of the work plan and the main focus area. So after there will be those two presentations, and we will hopefully have a bit of time at the end of the session for some Q&A. So feel free to drop your question in the Q&A box, because we're gonna go to it at the end of this session. Next slide. So in the next few slides, so I will present the next few slides I will present it are based on some coping exercise that was conducted in 2024. And this exercise was really helpful in order to frame the topic for the global nutrition cluster. So the document you see is available online on the climate crisis webpage of the GNC. Next slide. One of the first questions actually we ask ourselves was what really makes the current climate crisis different from because we have been responding to climate disaster for decades. So let's take a closer look at how the climate crisis is reshaping the landscape of humanitarian and nutrition work. So climate change first impacts manifest in three interconnected ways. First, so there are those short-term climate shocks, such as flood, storm, and drought on the left side. But we have also on the right side much long-term of slow onset changes, such as sea level rise, temperature increases, or ocean acidification. And in between, we have we see climate variability, and this brings some change in seasonality, climate pattern. For instance, so rainfall onset and duration are changing, and there are also more temperature fluctuation. And this is also particularly important for nutrition because we know that how seasonality can affect food availability, disease outbreak, and care practices. So the way we have been looking at it is really considering the first two boxes and saying that, yes, for nutrition response, we are looking at climate change and climate variability. But let's now look at some of the key shifts and challenges that we are seeing in the current climate crisis and how they relate to nutrition. So for the first one is really critical to recognize this bi-directional relationship between climate and nutrition. So it's not just about climate affects nutrition, but we need also to think about how our system, our nutrition response and humanitarian response impacts the environment, both positively or negatively. And this thinking is not yet completely included in most emergency and development frameworks. The second is really recognizing that we are observing a shift in the level of risk and uncertainty around climate change. And these changes are also impacting early warning and forecasting systems. So for instance, rainfall and storm patterns are changing, making it harder to act early. And this creates really challenges for timely and effective preparedness for nutrition actions. Third, we are seeing the emergence of I mean, it's not it's the last box, but third, we have also need to recognize that crises are no longer isolated. So climate shocks often is the same community repeatedly, sometimes alongside a conflict or economic stress. And each shock erodes resilience further, making it harder for communities to recover, especially where diet and services are already fragile. And finally, we are seeing also new emergence of new climate related hazards. One of them is, for instance, the heat waves. And we know now that heat waves have a direct impact on the, pregnant and lactating women and girls. But these new challenges, climate shock, are not yet systematically addressed in response plan. Next slide. So this slide, I will go very quickly through it. It's just to summarize what is our primary focus. I already mentioned it. It's really looking at climate and extreme weather event and seasonal shift. And why? Because there are really those events that are triggering the kind of humanitarian need and nutrition response, which is within our humanitarian mandates. But also just flagging again that it's equally important also to look at these bidirectional relationships and not to forget how we can also look at the environmental impact of our nutrition response. Next slide. So we are seeing more and more evidence and on the relationship between climate and nutrition outcome. I mean, still this evidence needs to be improved, but we have growing evidence that there are negative associations between climate shocks and outcomes such as weighting and stunting. Underweight, high temperature, as I mentioned, are linked to low birth weight, preterm birth, and child undernutrition. And there is also some emerging evidence on overweight and obesity. We know also that this impacts varies according to geography, to gender, livelihoods, and displacement status. And this underscores the need also to bring a climate justice lens to our programming. Next slide. So again, I will not go through these figures, but it was just to illustrate kind of the multiple and interconnected impact pathway from climate to nutrition. And also to see that we are already seeing some strong link, but still some further research is needed in order really to understand those different pathways in order to inform the design of integrated climate and nutrition programming. Next slide. Next slide, I will skip this one. So with those introductory slides, I'm going to go now to present a bit of the GNC Climate Crisis Working Group. What have we done so far and what are we planning to do? So those slides have been important just to explain you why we think it's important for the nutrition community to look at the climate crisis and understand how we can move into a better integrated climate and nutrition programs. In terms of the background of this working group, so it was initiated in 2022 as a work stream, but and then formally established as a GNC cross-cutting working group in 2023. So currently we have 2 co-chairs, so myself and Blanche Materne from the French Red Cross. what has been done between 22 and the formal establishment in 23 was a survey which was done actually during the, another global event to understand what the different members, GNC member interest in this agenda and the way they want to look at it. Next slide. So since 2023, you can see there is a number of partners that have joined the group. So the group is now now TORs that are defined around 4 main objectives: raising awareness on the climate crisis and nutrition nexus, stimulating this technical collaboration, knowledge exchange, and sharing of experience within nutrition GNC nutrition members and the wider nutrition humanitarian community from global to local. Identifying gaps and as needed, maybe developing some new guidance. Also trying to mobilize some expertise, probably outside the nutrition community as it's related to climate. And finally, with this group, we wanted also to further engage with already existing climate-related initiatives, including those within the humanitarian system, such as YASC, some YASC working group, but also outside the humanitarian sphere and the groups which are active in more development sphere. Next slide. So in order to develop the work plan of the working group, we had a very participatory work planning process in the first trimester of 2024, and we define 5 main focus areas, which is for 24-25. It is quite ambitious, but it's really kind of a comprehensive work plans that really touch on what we see as important in terms of areas for climate and nutrition in emergencies. Next slide. So the first area is looking at climate and nutrition risk analysis and anticipatory action for nutrition. So our focus has been really on these 2 elements since last year. And just to provide you some example of what we have in terms of activity and deliverables. So we did some session last year about anticipatory action and nutrition in the regional consultation for the GNC. We've been working on a mapping of stakeholders, working on anticipatory action and nutrition, and we are planning to establish a sub-working group on the topic very, very soon. And this, we want to do it in collaboration with the Nutrition Information System Working Group, because it's really about how do we use early warning system and nutrition vulnerability analysis in order to trigger anticipated actions. There is a new project which has started already, supported by the SIDA donor. Is being implemented in Yemen and South Sudan to support locally led nutrition sensitive anticipatory action. And this group will really support the implementation of this project. And finally, we have some learning events that are being planned for the second half of this year. Next slide. Second focus area is really looking at the climate and nutrition pathway and how to better how to include climate adaptation into nutrition in emergency programming. So the focus is about raising awareness about this climate and nutrition linkages. We did recently a webinar on this. Trying to socialize and the evidence, and also engaging further with some other initiatives I mentioned, such as ICANN, the initiative on climate and nutrition, and support also participation in some advocacy events such as the COP or the N4G. So it's also the opportunity for me to inform you that in terms of deliverables, we are about to publish a Q&A type document, which is an overview on climate and nutrition. So this is coming very, very soon. It's almost finalized. Next slide. So this area is about this really looking at this bidirectional relationship between climate and nutrition. And as we said, it's also looking at how nutrition programming is impacting on the environment. So our focus is about tools for this environmental risk analysis for nutrition programming. And for this, just an example, so there is also a tool which is currently being developed and will be finalized over the summer. So stay tuned because we will present this tool. It is developed with REH network, and it will come in the second half of this year. Next slide. Climate and localization, the two agendas are definitely very much interlinked, and we want to explore further this. So it's really also to engage with the localization working group. We just heard about them. And last point is really about, next slide, is looking at the coordination function of the GNC and how we can apply a climate lens across the different tools that are being used, and further engage also with the different coordination group that exist. So including, for instance, this GCC climate task force, so which where climate, so GCC is a global cluster climate coordination group, and under this group there is a climate task force. So it's also to be involved in those different initiatives where climate and humanitarian response are discussed. Thanks a lot. I will stop here for this presentation. Next slide. Yes. So this is for this quick presentation about the work plan of the working group. So we will have two presentations now to focus on one specific focus area. So the first one I touched on, which is looking at integrating nutrition into anticipatory action. This presentation will be delivered by two colleagues. So the first colleague is from Decoda. The presentation has been recorded because she's based on in Australia, and she's going to present some work which has been done in for the Asia and Pacific region with WFP.
Tēnā koutou katoa from the South Pacific. My name is Mari Scar-Manger. I'm Deputy Director with Decoda. Today I'm going to present work we carried out last year with WFP RBB and 5 WFP country offices in the Asia-Pacific region. I'd like to acknowledge the valuable inputs and discussions from the country offices of Philippines, Bangladesh, Lao PDR, Nepal, and the Pacific Multi-Country Office, and of course staff at WFP RBB and my Decoda colleagues. The work I'm presenting today was part of a broader piece aimed at investigating and assessing the direct and indirect effects of climate change on all forms of malnutrition in the Asia-Pacific region. The purpose was to inform the integration of nutrition-focused strategies into WFP's climate response system in countries most at risk. In summary, the opportunities for integrating climate change and nutrition and adaptation strategies and interventions exist along the continuum of responses, from immediate reactions to shocks, through strategies that build resilience to the promotion of nutrition and health. AA is not a cure-all, but does play an important role in the mix of nutrition-focused strategies. It allows nutrition-preserving actions to take place before a shock occurs. It can enhance nutrition resilience between shocks, and it can be used for the promotion and protection of nutrition and health. AA isn't new, but nutrition has historically been under-integrated in anticipatory action systems. AA already is and can mitigate the impact of shocks in nutrition on nutrition in a variety of ways. It can target the most vulnerable, children under 5 and pregnant and lactating women. It can help maintain access to nutritious diets in times of crisis. It can protect key behaviors such as exclusive breastfeeding, which is often disrupted during climate shocks. And it can prevent harmful coping strategies such as meal skipping or selling productive assets. This is not just about protecting health, it's also about reducing long-term social and economic impacts of malnutrition. This slide is a bit busy, so let me walk you through it. First, it shows what AA is. Post-forecast trigger, pre-emergency, the area between the blue lines. The bullet points show typical components of AA, with the actions in green font being actions that are also AA for nutrition. For example, unconditional cash transfers have been associated with improved food security and nutrition outcomes. The additional points in the green boxes and new AA for nutrition actions that could be introduced. AA for nutrition would ideally build further nutrition sensitivity of existing AAs and or introduce new actions. Further, it's important to differentiate between slow and sudden onset shocks because choice of interventions and timing will vary. Impact-based forecasts shifts the focus from the hazard to impact on people, infrastructure, and the environment. And noting here that there is more scope to use past trends and modelling to predict nutrition-relevant impacts. By developing pre-agreed malnutrition triggers, we can enable rapid action before malnutrition rises. And lastly, in terms of feasibility, these interventions are often extensions of existing systems, such as cash transfers, just deployed earlier. We are building a repository of AA practices across the Asia-Pacific region. The intention is to document what works across sectors with nutrition outcomes in focus. We encourage partners to contribute case studies and examples. So, the goal of this piece was to identify opportunities for integrating nutrition-sensitive strategies into WFP's Climate AA in selected countries of the Asia-Pacific region. The 5 countries, Bangladesh, Fiji, Laos, PDR, Nepal, and Philippines, were selected because they were at different stages of readiness with regards to AA and integration of nutrition in AA. This was intentional in order to reflect a range of operational contexts and to advance learning in the more advanced countries, which can then be applied in emerging countries. We wanted to identify concrete entry points for nutrition in existing AA work, identify opportunities from the beginning of AA adoption, and to work with established AA systems to identify something slightly less business as usual. So the stepwise process we worked through was started with a review of government and WFP documents identified by website searches and shared by the country offices, for example, national climate change policies and WFP's country strategic plan. This was followed by a group interview with WFP country office staff representing climate change adaptation, social protection, nutrition, VAM, and so on, complementing the document review and helping map the current AA pipeline. We then carried out a brief analysis including a summary of climate and nutrition vulnerabilities, pathways from climate change to malnutrition, climate adaptation and social protection, and how WFP works in the country. We also assessed the country's level of readiness for integration of nutrition in AA. After this, we produced a problem statement and shortlisted opportunities for AA for nutrition, usually 3 per country across different areas such as early warning messages, school-linked actions, and farming-related actions. The analysis and opportunities were then validated with the country office with further discussions to select 1 final opportunity per country office. Last, we developed a concept note per country. This slide shows the level of readiness for integration of nutrition into AA using the ICAN framework. Laos had the lowest level of readiness with limited implementation of AA despite a robust legal framework for disaster management. However, the recent Early Warning for All roadmap and feasibility study on AA provided promising potential for the development of AA in the country, including the integration of nutrition. Fiji's 2023 Anticipatory Action Framework saw AA due to be piloted at the time of this project. What's unique about the Fiji model is that AA is fully integrated with the government's existing social protection infrastructure. Similarly, Nepal was in the process of officially institutionalizing their existing AA programs. Bangladesh has made significant strides in integrating AA into its national disaster management framework. The Philippines, for example, has been developing AA since 2015. At the time of this work, the Philippine government was in the process of institutionalizing AA, ensuring that all local government units could access funding and adopt AA protocols tailored to their specific local contexts and hazards. On to the opportunities we identified. I've presented Laos, Fiji and Nepal on the same slide because the opportunities tailored to the level of readiness ended up similar. The final opportunity for Laos and Fiji is the integration of nutrition messages into early warning messages, and for Nepal, WASH messages would be integrated alongside nutrition. The goal of these projects is to mitigate and reduce the impact of droughts and floods for Laos, cyclones for Fiji, and flooding for Nepal on nutrition in pregnant and lactating women and children under 5 through early warning messages. For Laos, we would do early warning messages only. For Fiji, adding an SBC component, and for Nepal, an SBC component plus capacity building and preparedness activities. The final opportunity selected for Bangladesh was refining cash top-up targeting by integrating nutrition vulnerability data in the AA beneficiary database and inclusion of Mother MUAC collection. The goal is to prevent the immediate impact of monsoon floods and cyclones on the deterioration of adequate food consumption, acute malnutrition, and breastfeeding rates among pregnant and lactating women and children under 5 in flood and cyclone-prone areas. This project leverages WFP's AA beneficiary database, which does an annual verification exercise to collect which we then would use to collect additional nutrition indicator data and also to train mothers in MUAC measurements. The project also ensures that SBC approaches are integrated into AA delivery. Last, we have the opportunities for the Philippines. The next step in Philippines' AA journey is the 2022 to 27 multi-hazard impact-based forecasting and early warning system project, supported by the Green Climate Fund, of which WFP is an implementing partner. This project addresses the need for a more proactive, inclusive, and people-centered climate risk management and is a paradigm shift in the forecasting and early warning system, from one that is traditionally hazard-based to a system that is impact-based. This project presented a unique opportunity for ancillary pilots of the integration of nutrition and became the final opportunity for the Philippines. The project would start with in current pilot areas to refine the methods for selection of beneficiaries based on existing nutrition data, and to expand and refine early warning nutrition messaging, and also to pilot cash top-ups for households with pregnant and breastfeeding women and children under 5 who receive AA cash transfers. Next, all the lessons learned in existing AA areas would be applied to the pilot in the impact-based forecasting areas. To conclude, a summary of lessons learned during this process. There are significant opportunities to enhance existing AA interventions by making them more nutrition specific and sensitive without requiring substantial additional investment. And there are also significant opportunities for refinement of targeting to reach the most vulnerable. There's a clear gap in guidance for integrating nutrition considerations into both research and programming in the context of climate change and AA. Guidance needs to be tailored to the AA maturity stage, and guidance needs to place AA in the context of broader climate change adaptations and slow versus sudden onset shocks. And greater efforts are needed to link AA interventions with cash-based approaches, ensuring both are designed to be nutrition-specific and sensitive. And the lack of evidence underscores the need for further piloting, evaluation, documentation to strengthen the understanding and integration of climate change, AA, and nutrition interventions. So thank you for the opportunity to present. And we invite collaboration. This is still an emerging area and we need more voices, especially from the region. Please document your AA nutrition examples and share with us. Thank you very much.
Thank you. So this was the presentation from DCODA based on the work they did for the WFP regional bureau in Asia and the Pacific, in South Asia and the Pacific. So now we will give the floor to Maureen. So Maureen is the regional anticipatory action focal point for the Eastern region for WFP. And she will present on their efforts and experience in integrating nutrition into 4 countries in this region. Maureen, the floor is yours.
All right. Thank you very much, Domitille, and good morning, good afternoon to everyone. Thank you, Domitille, for introducing me. I will take you through some of the work we have been doing in Eastern Africa on anticipatory action and the efforts towards integrating nutrition in the various initiatives. If we could move to the next slide. Next, okay, good, thank you. So this is a map that, sorry for the red font, I hope it is visible. But this is a map of the countries covered by anticipatory action work by WFP in Eastern Africa. And as you can see from the map, we have 8 countries covered with the work on anticipatory action. Some of the countries have progressed quite a bit with the anticipatory action programming, and some like South Sudan, Rwanda, and Somalia are starting up various efforts on working with anticipatory action. And then in terms of the kinds of hazards covered in this region, mostly we cover floods and droughts as the 2 main hazards that are driving food and nutrition insecurity in the region. But increasingly, there's efforts and discussions around covering other non-climate related hazards, or at least connected to climate in a way, such as pests and diseases and conflict. But as WFP, we are yet to design anticipatory action systems for non-climatic hazards. If we could move to the next slide. Okay, so in terms of strategic engagement by WFP with anticipatory action work globally, we have an anticipatory action strategy where the vision is that anticipatory action, especially when it relates to hazards that are predictable, and we could take some advanced actions such as floods and droughts, that these kind of efforts are helping to protect people's food and nutrition security, as well as lives and livelihoods from predictable climatic impacts. And towards this, we have 2 broad goals. One is to strengthen national and local capacities to be able to develop systems, but also to deliver anticipatory action. And then the second goal is for us to be able to deliver the anticipatory action interventions at scale to the most people who are most in need. Next, please. Let's go next, if you could click a bit more. So in terms of what we have achieved so far in the region, there's work ongoing to develop anticipatory action plans that basically are plans that factor in what actions will be implemented, where, using what triggers that tell us when to act, who will we target, how many people will we cover, how much money is needed, amongst other information. And this work to develop these plans is ongoing in all the 8 countries that I mentioned, but specifically, we have draft plans for drought developed for Djibouti, Burundi, Ethiopia, specifically the Oromia region, and Kenya. And then we have draft plans developed for floods in Ethiopia, the Somali region that's in the south of the country, Uganda in Karamoja, that's in the northeastern part of the country, and Somalia. But then we also have anticipatory action plans that have been completed, in the sense of we have gotten the plans to as good a place as we can make them at this particular point. And some of these plans have already been activated for implementation. So like the one for drought in Somali region, as we speak, they are finalizing the recent activation for this year ahead of a forecast of potential drought. And then the other one completed is the one for Uganda, covering Karamoja region. And all of these plans are usually developed, or rather co-developed together with technical working groups, either at national level or subnational level. And these technical working groups usually involve a broad range of stakeholders, from UN agencies to local NGOs like World Vision, WHH, Mexico, and others, to various government and sectoral ministries, from agriculture to water to livestock to disaster management. These technical working groups, in many places, are actually co-led by government entities, mostly the disaster risk management entities, and they provide a platform for different sectors to come together and work together to figure out what anticipatory action interventions will be best placed to implement in different places in the country. So far, from this work that we've done in Eastern Africa, we have had 3 anticipatory action plans activated in 2024 alone. That is one for drought in Ethiopia, Somali region. And then we have the one for floods in Somalia. And then we had the one for Burundi last year for floods. And so far, through work with our headquarters, WFP has prepositioned and then disbursed about 6.6 million to support delivery of anticipatory actions to the ground in 2024. If we could go next, please. In terms of the targets, globally, we have a target that by 2025, and by 2025 it's also because this strategy is linked to our overall global WFP strategy, which had a timeline of up to 2025. That's why you're seeing these targets here. So globally, by 2025, the plan is that WFP will have anticipatory action systems delivered in at least 40 countries globally. And out of these 40 countries, already we have seen that eight of them are in Eastern Africa. And then the second target is that by 2025, WFP globally would like to have at least 35 anticipatory action plans approved, such that they are ready for getting prearranged funding and ready for potential activation in case triggers are reached. And the aim is to cover about 5 million people. And we are seeing out of that, we already have 2 anticipatory action plans approved for Eastern Africa. And these 2 plans alone are already covering 2.1 million people. But we expect that in Eastern Africa, by the end of 2025, many of the plans that you're seeing on your screen as draft plans will have already been completed and approved for potential activation. Next slide, please. So coming into the discussion on where does nutrition fall in all of that. So the table is a snapshot to show you what's currently ongoing in the region in terms of which countries so far have considered nutrition as part of their anticipatory action plan. And as you can see, in terms of the impacts to be addressed, you can see that most of the countries, when they think about what impact they want to minimize or avoid, if that is possible, the impacts often relate to increased food and nutrition insecurity, or at the very least, for the case of Somalia, really preventing disruption to nutrition services in the case of when a flood occurs. In terms of what anticipatory actions are designed, as you can see in the table, most of it relates to scaling up malnutrition prevention programs, such as the work that is ongoing in Djibouti. But some of it also includes things like we give cash transfers, but together with a top-up, such that people are able to take care of the nutrition side of things. For the case of Somalia, because we're dealing with floods, there was work around prepositioning and distributing nutrition commodities before a flood, because in the event that a flood happens, these kinds of services are usually disrupted. In terms of the expected outcomes, we see that most of it relates to reducing malnutrition caseloads across board, or improving food and nutrition consumption. Next slide, please. Okay, so what results have we seen so far from the AA activations in Eastern Africa? I'll first of all start with the case of Ethiopia, when they activated AA for drought back in October 2022. And the interventions delivered on the ground were cash transfers, early warning information, and rehabilitation of rangeland areas where they were targeting mostly pastoral communities. Next, please. So when we did an endline survey, these are the results that we got, specifically looking at the food consumption score. Just a matter of helping us to understand this graph, the treatment group refers to the group who was supported with anticipatory action interventions, and the control group relates to the people who did not receive anticipatory action assistance. And the idea was to compare, was there a difference when people are supported by anticipatory action and when people are not supported by anticipatory action? And when we compare the baseline and endline results, we see that while the treatment group started at 1% of the population being severely food insecure, at endline, they only ended up with 5% of the people being severely food insecure. When you compare this with the control group, you see that they moved from 2% to 55%, which then leads to the conclusion that anticipatory action really helped to prevent a large number of people becoming severely food insecure. Next one, please. Now I'll move to the case of Somalia, which was about floods. And in this particular case, the actions that were delivered were nutrition commodities that were prepositioned and then distributed before the floods, cash transfers, and early warning information. And then similar again to Ethiopia, we see that when you compare the people assisted with anticipatory action compared to the control group, which is written CG, we see that the percentage of people who ended up being having poor food consumption score or severely food insecure is actually much lower for anticipatory action support compared to the people who did not receive any particular support, but also compared to people who received support post the flood event, which is the FR that you see there. If we could move to the last slide. So, which leaves us with still a few questions. While we see country offices, WFP country offices have really made some efforts to integrate nutrition in the anticipatory action plan, there's much to still be figured out in terms of how best this is designed such that we can achieve nutrition outcomes as much as possible. So for example, the first piece of work is similar to what Domitille was presenting. Can we define a good pathway of how climate conditions lead to malnutrition or nutrition outcomes such that it can inform the second question, how best do we design anticipatory action interventions related to nutrition, in the sense of thinking through, does anticipatory action mean mean we need to design the nutrition interventions differently or deliver them differently such that we can be able to reduce the caseload as much as possible. And then number 3, the anticipatory action plans, even the ones that have been implemented so far, the triggers really relate to the hazards, such as information to tell us, is there potential for below average rainfall or too much rainfall that could lead to a flood? But we don't necessarily have triggers that are linked to specifically nutrition in terms of telling us to what extent will it lead from having a flood to malnutrition cases, which is linked to the first point, that if we can have a better understanding of the pathways, then we can connect this to how do we design focus and triggers to be able to better anticipate malnutrition cases. And then lastly, while the previous slide was showing you results from food consumption score, we did not necessarily measure nutrition outcomes. And so one of the questions we are currently figuring out is how best do we measure nutrition outcomes when AA and nutrition are integrated, and especially considering that AA are short-term interventions, and so we need to think about how this could be linked to more longer-term nutrition outcomes. That's the end of my presentation. I hand it back to you, Domitille. Thank you.
Thanks so much, Maureen, for this very interesting presentation. I'm afraid we won't have time today for the Q&A. I'm very sorry for that, but I think we had a very comprehensive presentation. Please feel free anyway to drop your question in the Q&A box and we can respond to them afterwards. I would just want to thank all you again for the participation. Thanks for our speakers, and say that much more is going to come in the next month. So we are working on guidance. We are working on several briefs. So please look at what the Climate Working Group is doing. Look at what WFP is producing on anticipatory action and nutrition. Let me pass over to you, Iris. Thanks a lot.
Thank you so much, colleagues. Great presentations. Now we have the session 12, People-Centered Approach to Nutrition in Emergency. And I'll present the leads for the session. We have Dennis Kyoko Mapega. He's a localization specialist. With the Global Cluster Coordination Section, UNICEF EMOS, he currently provides support to the UNICEF-led co-led clusters and AOR on localization and in the global and local levels. And Christine Lang is a program specialist on disability, inclusive humanitarian action with UNICEF, working with the UNICEF Global Cluster Coordination Team. Christine is also co-chairing the IAS Disability Reference Group and the Anticipatory Hubs Working Group on Protection, Gender, and Inclusion. Prior to this role, Christine has worked with UNHCR, UNWRA, and various NGOs in Gaza, Afghanistan, Papua New Guinea, and other contexts. So over to you, Dennis and Christine.
Thank you very much, Ruben, for the introduction. Welcome again, everyone, and thanks for joining in this session. We're really grateful for having this opportunity to discuss a people-centered approach. And in this session, we will aim to deepen our understanding and collective commitment to people-centered approach in nutrition in emergency. Over a period of, in the next 45 minutes, we will explore concrete examples that bring this approach to life, from disability inclusive nutrition programming in Kenya to a recent UNICEF practical guide on learning efforts. And throughout this session, we urge please, in case you have any questions, you can post in the chat any question and any reflections. We will also have an opportunity during this session to respond to the question and answers during a Q&A sessions. To begin with, allow me to please introduce our first speakers, Rumana Isaac, the Meal Assistant, and Akutan Nelson, a Senior Program Coordinator from Save the Children in Kenya. They will showcase one compelling examples of people-centered approach, that is disability inclusion through an intersectional lens in Kenya. Welcome, Rumana and Akutan. Thank you.
Thank you so much for this opportunity, and I'll be presenting. I'm Rumana Isaac. I am the meal assistant from Kenya. So I'll be presenting the bridging gap, and I'd like to go to the first slide, please. Not that one. It's not that one, kindly.
It's the
If you can go
presentation.
to our
Okay.
presentation.
Bridging the gap.
Yes, bridging the gap.
Ruben, it might be that it's second in the slide deck if you want to keep scrolling through. This presentation will be next.
Yeah, just scroll, continue scrolling.
Continue.
Keep going. It's the presentation that was called Bridging the Gap, Disability
Yes.
and I'll also open it at my end. Might be. Here we are. Perfect. Thank you.
Over to you, Rumana. Thank you.
Thank you so much. So I'll be taking you through this session, and I'll be taking you through in terms of our disability and nutrition in Kenya. We have implemented in terms of our project. So my colleague Akutan will be joining online. So let's continue to the next slide, kindly. Next slide. So I'll be taking you through in terms of the overview of disability in Kenya. So this is a report that was done by WHO on disability in 2011. An estimated 1.3 million people experience at least one disability. This represents 16% of the world's population, or it means 1 in 6 of us. And however, in Kenya, the data is inconsistent. According to the People, Population and Housing Census of 2019, persons with disability only account for 2.2% of the general population. For example, the Kenya Institute of Special Education conducted a national study on children and found out that the prevalence rate of children with disability aged between 2 to 21 years in Kenya is 11.4%. And this shows that many people with disability are not accounted for. If you look at the general population and housing census that has been conducted, and this points out to for need for better data to inform inclusive policies and services. Next slide, please. In terms of what we are doing as Save the Children, there is a project that we are undertaking, which is called Accept, and we are trying to, one of the main aim is to reduce preventable child mortality and improving nutrition. And the other focus is to strengthen health system and promote equitable access to have essential services for nearly 150,000 children under 5 and pregnant and lactating women. The project also supports 88,000 caregivers with nutrition, education, and advocate for inclusive accountability health policies. We also have conducted, as a project, we have conducted a mapping, that's a disability mapping and consultation exercise with the CHPs, that is community health promoters and people with disability across community units that we support in Turkana and Mandera. Next slide, please. According to the mapping that we did, these are the findings in terms of the community unit that we are supporting. These are the number of disabled persons per community unit. As you can see, the numbers, this means if you look at the graph shows you that as much as we are trying to reach all the people in the community, there's also that aspect of the people with disability that the project is willingly trying to reach. And that's why the mapping was done, to make sure that no one is left behind. And this is in terms of now the numbers of people per community unit that we identified during the mapping. Please, next slide. According to the findings from that mapping, in terms of gender, you can see in terms of the counties, there is a variance in terms of female and male. But when you look at the overall, you can see that female are the most identified in terms of having different types of disability. And if you look at also in terms of age, you can see the most affected age is between 18 to 59 years, and then followed by above 60 years, and then also followed by 5 to 10 years. But according to the study, 34% of the children with disability are under 18 years. Next slide, please. These are the key barriers that we found in the study. One of it was we are using the social module, and the barriers that we found during this study or this mapping was from the qualitative analysis. This is the accessibility barriers. As you know, persons with disability often struggle to access essential services like healthcare, education, and social protection due to the physical inaccessibility and lack of assistive devices. So those are in terms of accessibility, the barriers that we identified during that time. And then we have accessible communication and knowledge barriers. Often the health information is not tailored to most of it's not tailored for them to access in terms of people with disability, because you'll find someone who is deaf, and maybe whatever you are, the information you're giving out, or someone who is blind, the information you're giving out is not tailored to communicate to them, which limits their ability to make informed health decision. And then in regards to which as well affect the health-seeking barriers, it's interconnected. So in terms of the health-seeking barriers, we have issues in terms of disability-friendly services, such as lack of language interpreters at the facility level, and also lack of trained staff to ensure that disability inclusion is taken into place. which mostly this create communication challenges, especially for the people who have intellectual disability. And as well, if you look at, we found out in the study that there are also physical, emotional, and sexual violence, which most of the people are at risk of physical, emotional, and sexual violence, especially in the environment where they are dependent on caregivers or isolated from the community. The abusers often take advantage of their perceived vulnerability because they know they are not able to maybe do any reporting and all that. And then we have the economic barriers. As you know, living with disability often involves additional cost, like having assistive devices ensure that you have to procure medications and also having to move from one place to another. And also the caregiver needs support in terms of even psychological support, which makes it even harder for them to save and have economic activities to be done, especially for those who don't even have social protection. And then we have policy and practice barriers. This one, as you have seen in the first in the first overall overview of my presentation, was one, we lack reliable and segregated data in terms of disability is very scarce in Kenya, which makes difficult to design any inclusive policies or allocate resources effectively. And this leads to underrepresentation in national statistics and planning. Next slide, please. In terms of the learning that came out from this mapping that we undertook, which we had feedback from even the caregivers and also the children, one of the things that came out was the study found out significant social stigma, which led to underreporting of disability, especially among children. Family often hide children with disability due to fear of discrimination. This results in isolation, limited access to services, and also distorted disability data that you have already seen above there. And then the mapping exercise challenges the myth that people with disability are too few to be included in the mainstream health and nutrition program. So in terms of what we are trying to do for this specific for this one is we as much as we're trying to mainstream this even in our reporting and everything, we try to make sure that the people living with disability are included in terms of even our reporting. So in the other learning, in terms of the data use, as much as we will be collecting as much as you are collecting the data alone is not enough. It must inform program design and adaptation. And how can we do this for us to ensure? We need to make sure that the voice and also we need to be accountable. And how can that happen? We need to engage people with disability directly, ensure the experiences are authentically represented, rely on proxy respondent risk, misrepresenting or overlooking critical insight. And as well, we can do direct consultation to more accurate needs assessment and strengthen advocacy efforts by providing compiling lived experience narrative.
Many thanks, Romana. I will request if you can wind up because of time. Thank you.
Thank you. You can go to the last slide, please. Yes, in terms of how we can do, it was just a programming or an implementation mapping that we did. So in terms of what we can do, in terms of our programming, in terms of adaptive programming, in terms of project design and implementation, we should make sure the communication and training are more accessible, conduct gender segregated disability inclusion, and also community dialogues on children should be desegregated in terms of gender. And also we can promote joint household decision making through inclusive methodologies, build capacity of CHPs, that's community health promoters, to facilitate gender and disability responsive approaches. And also in terms of participation and voice, we can involve male engagement in maternal and child health, including male with disability. And as well, we can involve community leaders to shift norms and promote inclusive participation, and as well ensure inclusive marginalized group, e.g. women with disability, adult mothers in dialogues. And in terms of advocacy, we can advocate for disability inclusive policies, assistive devices, and gender responsive healthcare, and further learning and adaptation. We can monitor and adapt GACI strategy using both disaggregated data and disability inclusion tools. Next space. Thank you all for listening. I think my party shot will be disability inclusion goes beyond awareness and it needs deliberate action backed by accurate data. Without reliable data, effective policies and program cannot succeed. Prioritizing better data collection and enforced disability inclusive policy is key to ensure that we leave no one behind. Thank you so much, and back to you, Dennis.
Thank you very much, Rumana. In case you have any question, any reflection, please feel free to post in the chat. I'll invite Christine to take us to the next presentation. Over to you, Christine. Thank you.
Thanks a lot, Dennis, and thanks a lot, Romana, for that really interesting presentation. So I'm going to be very brief so that hopefully we can have a little bit of time for Q&A. I would just like to introduce a new guidance that we have that we'd like to share with you on a people-centered approach to cluster coordination. Now, I imagine that when we speak about new guidance, many people are saying we really don't need new guidance, particularly at this time we're already feeling overwhelmed by a lot of different issues. And so what this guidance really aims to do is not introduce new guidance, not introduce new themes, but it aims to bring together a number of different cross-cutting issues in a more coherent and joined up way. So it's really intended to address some of the challenges that we have about multiple and overlapping guidance. We can move to the next slide. Great. So this guidance is on a people-centered approach to cluster coordination. Now, this guidance is very much a response to the requests that we were getting from those of us working on cluster coordination in countries to have a more joined-up approach to the various cross-cutting issues that we're all working on. So we have, for example, accountability to affected populations, localization, GBV risk mitigation, disability inclusion. How do we address these in a way that is not so siloed, that isn't about addressing multiple guidance, but that's a much more joined up way? So this guidance brings together all the existing guidance on those thematics and really brings them together and applies them specifically to cluster coordination. Now, we often get asked, what do we mean by a people-centered approach? What is it exactly? It's a term that we keep throwing around. We do include a definition in the guidance document, which is that it ensures humanitarian actors are held accountable to affected populations by using an intersectional lens to identify and respond to the needs, capacities, and risks of the affected population in all their diversity and enabling their participation and leadership. So it's about bringing those issues together. Next slide, thanks. So what does the guidance include? The guidance is meant to be very practical. It's not meant to be an extensive description of what each of these issues are in isolation. It's not meant to be an overview of what is AAP, what is localization, what is disability inclusion. It's really about providing the minimum, the basic standards for how, in practice, we have a more integrated approach to applying these cross-cutting issues in cluster coordination. So it has three key sections. The first one, we provide a bit of a rationale, a bit of an explanation. What is a people-centered approach? Why this guidance? Who is it for? And we then go into some key actions for each core function. Now, what's key in this guidance is that we don't have, for example, key actions for AAP, key actions for localization, key actions for inclusion. We avoided that approach. What we have is under each core function, what are the key actions that can bring together all of these various thematics? And then in the annexes, we go into a little bit more detail around the theory on how these different issues intersect. We can move to the next slide. And just an example here on this slide, which we can share with all of you afterwards, of course. So the guidance really aims to link directly to the work that the clusters do. So for example, there's a table on if you are conducting a needs assessment, which specific action should you be looking at? In this case, 1.1, 1.2, 2.2. If you're running a country-based pooled fund expression of interest, which key actions should you be looking at? So the guidance includes a bit of a practical table to help us with that. Next slide, thanks. And what we've included on this slide is just an example. So under core function 1, the guidance includes just four key actions that are meant to address all of these various cross-cutting issues. So one being ensuring that meaningful engagement with different segments of the community is ongoing, monitoring access to services for population groups, reviewing and discussing feedback from affected populations, and ensuring meaningful participation and leadership. So under each of those key actions, the guidance also includes a little bit more detail. We're in the process now of putting together a bit of a toolkit where we can also have links to practical tools for each of these key actions. But just to give you a sense of how we've tried to again, not have those silos of the individual cross-cutting issues, but really bringing them together. We can move to the next slide. So what next? This is my last slide. I want to allow enough time for us to discuss. Now, we have a cross-cutting issues working group within the UNICEF Global Cluster Coordination section. The Global Nutrition Cluster participates. Our colleague Alex participates. So this group is now working on the toolkit. We're going to be working on dissemination. If any of you are interested in piloting this toolkit or in getting support for using the toolkit, please do reach out to us. We really welcome that opportunity to work with you. And we welcome any feedback on the guidance to improve it. And onto the next slide. That is it. So super brief to help us catch up on time. Thank you so much, Dennis. We'll put some links in the chat, and please do reach out to us if you are interested in using that guidance or having any technical support on implementing a more coherent approach to those various cross-cutting issues. Thanks, Dennis.
Thank you very much, Kirsten. Again, reminding all of us that in case you have any questions, any reflections, kindly put them in the chat. Many thanks, Kedir, for your comments on the guidance. We appreciate that. Our next session is we'll look at capacity strengthening approaches. And I'd like to invite Cecile, who is the GNC NIE Help Desk support, and Danka, who is currently supporting GNC in capacity strengthening. Both Cecile and Danka co-chair the GNC NIE Capacity Strengthening Working Group. Many thanks, and over to you, Cecile and Danka. Thank you.
Yeah, thank you, Dennis. I'll start, and then I'm going to pass on the word to Cecile. So, bonjour à toutes et à tous, and thank you very much for being here. Today, I'm happy to share the evolution of our capacity strengthening approach within the Global Nutrition Cluster. This is a result of the work of the General Capacity Assessment, Capacity Strengthening Working Group at GNC. We had a very short overview during the first day in the site, in the breakout room. But here we are going to present a little bit more in detail the why, the how, and the what of this approach. So this is not just a technical shift. We would like to have it as a strategic and deeply people-centered transformation, putting individuals and communities at the center of what we do. Next slide, please, Ben. Yeah, before going further, let's acknowledge, because we don't start from scratch. We did quite an important work already on capacity strengthening. Here you can see our offer, but also some numbers of our achievements. For example, The GNC e-learning platform, GNC Learn, has been visited by more than 20,000 learners, which is quite an important number. More than 500 professionals were trained through blended training in 12 countries in the last years, as well as more than 100 mentees from 42 countries have been supported through mentoring. From our technical training, we had more than 55 tailored training events covering more than 1,200 practitioners. So these are beautiful numbers. It shows the scale, the reach, and the relevance of what we do. But the numbers alone don't define the success, unfortunately. There are also a lot of people behind, so we are grateful to all our GNC team who contributed to this success. Next slide. But why do we need to rethink the capacity strengthening? Despite the achievements, we have to reflect critically. So trainings were often one-off and not sustained. We know that there is no longer-term strategy to embed our localized capacity, and often local actors were left out of leading and sharing their own learning. Also, when tools exist, they were quite fragmented and often too generic and not context-specific. In the today world of more increasing emergency increasing in scale and in complexity, we cannot longer afford to treat capacity strengthening as a checkbox exercise. So we needed to be more intentional and more people-centered and to meet practitioners' need where they are and what they are. Next slide, please. So in this changing world, as I said, crises are getting more complex, more frequent, and while the funding decreases, we also have the localization agenda, which demands local leadership, ownership, and accountability. We had previously a few presentations about the climate crisis, which pushes to redefine our NIE preparedness and response. So capacity strengthening is no longer optional. I think we all understand that, and it's foundational for our effective humanitarian response. When we say capacity strengthening, we don't mean just training, and we are going to emphasize on this all along because this means much more. This means investing in people, in their confidence, in their ability to adapt and to lead, as well as to their long-term engagement in their own capacity systems. So how we decided or how we envision to do that, and we will be really happy to have your feedbacks on that. I'm passing to Cecile to explain. Please, Cecile.
Thank you. Thank you, Denka. Hello, everyone. Can we go to the next slide, please? Thank you. So last year, the dedicated working group on capacity strengthening with the guidance of the GNC program leadership team, we spent quite some time and put some efforts to frame that more strategic approach to capacity strengthening. And it's available now on our website. You can have a look. It includes a theory of change that now drives our work. It's rooted in a simple but powerful idea, whereby if we equip NIE practitioners, and especially among national and local actors, with the knowledge, skills, tools, and confidence they need. And if we use more innovative and flexible approaches to learning, approaches that support peer-to-peer exchange, and that are truly responding to local learning needs and priority. Then we have the catalytic investment that leads to more locally led and more context-appropriate NI responses. Next slide, please. So what are we doing to realize this ambition? Right now, we are working on designing NIE learning pathways, closely aligned to the GNC's competency frameworks in nutrition coordination, information management, and NIE programming. We also want to make sure that all essential learning materials are accessible at different levels, available in multiple languages, and adaptable to the needs of country teams. Our goal is no longer to deliver training from top down, but to equip country teams so that they can design and drive their own national capacity strengthening plans. We believe that this can only happen through strategic partnerships, for instance, with universities, national training institutions, and with actors already embedded in national systems. And in addition, we're also exploring the use of generative AI to improve NI learning. For instance, embedding AI-powered tools directly into our resources. For instance, to create personalized NI learning pathways, or to transform large and complex guidance into bite-sized, digestible content that is easier to access, to understand, and apply in emergencies. So, to all of you, whether you're a coordinator, program staff, you implement, you advise, or to donors, please, we are inviting you to work with us to embrace this new way of doing capacity strengthening. Let's make it more local, more sustainable, because we are not just building capacities, we are shifting power. We are not just training people, we're empowering them. I have one last slide to tell you that next week, on Monday the 23rd at 2 p.m., we have a side session where you can join us and exchange ideas and brainstorm with us and work with us to make this approach real. Thank you very much, and over to you, Dennis.
Thank you. Thank you very much, Cecile, for reminding us that we are not only empowering, but we are not only training, but empowering. And also Danka for reminding us again that capacity strengthening is not an option. It's actually essential, particularly during this current time. Colleagues, we are remaining with some few minutes, so I would like to check if there are anyone who has any questions before we hand over the program back. Any questions?
Dennis, I see there's a few interesting questions in the Q&A. I'm trying to answer some of them, but there might be other panelists who'd like to come in as well.
Great. I see that there are some few Q&As in the question and answer section, and maybe just to also ask this question going to Christine. What does a people-centered capacity strengthening approach look like in practice?
Great. No, thanks, Dennis, for the question. And I think Cecile and Danka can also come in on that very well. I think from my perspective, but really interested to hear from Cecile and Danka, I think it's about when we do capacity building, and Cecile will be better placed to speak on how we do capacity building, but when we do capacity building, that we try not to have a separate activity on disability inclusion and then on AAP and then on localization, but see how we can really use every opportunity for capacity building to have that more integrated approach, particularly in this climate now where resources are limited, our capacities on the ground are going to be more limited, and we need to have more focus on on efficiencies, now is the time for us to try and build in that more coherent approach in our capacity strengthening.
Yes. May I add?
Sure.
Yeah, I think for us, in addition to what Christine said, we think that what's important to respect is that there is a lot of local expertise, and whatever we do needs to be adapted to the learners' realities, the learners' preferred modalities for learning, and that the actors feel really ownership and relevance. And this is what our approach would look like, to move away from just doing training. Capacity building doesn't necessarily, capacity strengthening doesn't only happen in the classroom. We need to do more of the peer-led training, the on-the-job training, the mentorship, the coaching, and co-develop all those capacity strengthening planning and tools with local stakeholders. This is also what resonates for me.
Thanks, Danka.
Maybe I want just to add one thing. I have been listening all the presentation and all the exchanges in the chat the last 3 days, and I've met capacity strengthening in many topics that are different, but they all refer to our nutrition in emergency field. So I think that is how we would like to center the capacity strengthening to people, just because if I am a practitioner and I have all that, I'm going to feel myself overwhelmed. So how do we do that in a cohesive and coherent way? And how do we address personalized needs? So this is something that we would like to, and how to make the way that the people can find the learning they need quick and easy. That's why I think this is the care for people in our case. That's the way I see it.
Thank you very much, our presenters. We really appreciate. Rumana has really shared the key things around the importance of data disaggregation, the importance of participation and voice. Kirsten was able to also share with us the new new UNICEF guide on quality programming and within the coordination. Cecile and Danka have really hammered the aspect of capacity strengthening and reminding us that it is no longer an option, but really essential. Many thanks, and I'll hand it over back to Ruben. Thank you very much.
Thank you so much both for chairing this session. I think it was a very rich session, so wonderful. We will now go into several options. So for those of you who would like to have a coffee or tea break, feel free to do that. We will be back in around 30 minutes. We also have a lightning talk, which is about mental health and nutrition, a comprehensive approach to sustainable change. This lightning talk will be done in Spanish. So if you would like to join, then please, if you would like to listen to this in English, go to the interpretation for the English. We will also have a networking session, and there will also be a breakout room in which you can see the posters. So you can go to your breakout room and select if you want to join the network session or look at the posters, or you can have a coffee or tea, or you can just listen to the lightning talk that will happen on this channel. We will be back in about 12 minutes. Thank you.
Hola, ¿cómo está? Mi nombre es Andrea Medina
Hello,
y soy
how are
oficial de
you? My
nutrición
name
para la
is
misión
Andrea
Venezuela de
Medina, a
Acción contra el Hambre.
nutritional
Hoy está conmigo mi
officer
compañera
for
Reisa.
Venezuela Mission
Hola, mi
Against
nombre es
Hunger.
Reisa
Grace is
Salazar,
with
soy
me.
oficial de salud mental para la
Hello,
misión
I'm
Venezuela de Acción
Rexa.
contra el
I'm
Hambre.
a
Hoy
mental health
hablaremos sobre salud
specialist
mental
for
y
this
nutrición,
mission. We
un
will
enfoque
talk
integral para el
about
cambio sostenible.
mental
Acción
health
contra el
and
hambre ha
nutrition,
comenzado una lucha y
a
hoy sabemos que
comprehensive
vencer el hambre
approach
exige
against
mucho más que
hunger.
alimentos,
Action
requiere abordar
against
aspectos que en
hunger
ocasiones no son
requires
visibles
more
para
than
todos.
food.
En los
Some
contextos donde
aspects which are not
trabajamos,
visible for
múltiples
everyone.
factores
In
afectan
the context where
simultáneamente
we
la salud
work,
mental y el acceso a
multiple
una nutrición
factors
adecuada. Y este
are
fenómeno se
make
evidencia claramente en las personas
adequate
cuidadoras de
nutrition
nuestros
and mental
programas.
health
Un
key,
alto porcentaje
and
de
how
ellos
the
enfrenta
caregivers are
situaciones
very
estresantes
important.
que limitan
Those
su capacidad de
caregivers
respuesta ante las
face
necesidades
stressing
familiares. ¿Por qué un
situations
enfoque
limiting
integral?
their response
Porque
capacity.
el
Why
hambre y
a
la salud mental
comprehensive
están
approach? Because
íntimamente
hunger and
relacionadas en
mental
un ciclo
health
que
are linked
refuerza la vulnerabilidad.
very
La percepción de
closely,
bienestar o malestar
reinforcing
de estos cuidadores,
vulnerability. The
particularmente de las
perception
madres,
of
tiene un
well-being
impacto
or
directo en el
being
estado
bad
nutricional
for
familiar.
these caregivers, particularly
Ahora, ¿cuál es el
mothers,
problema?
has a
Que
direct
detrás de cada
impact
caso
on
de
the
desnutrición
family.
hay una
What's the
historia que
problem?
muchas veces no
For
notamos,
each
la de quienes cuidan.
malnutrition
Imaginemos una madre
case, there is a
indígena que amamanta
history
a su
we do
bebé
not know.
y a la
Let's
vez
think
debe
of a
cuidar a su
tribal
padre
mother.
enfermo.
She's
O un
breastfeeding,
abuelo
but
que
she's
debe
also
criar solo
taking
a sus tres
care of
nietos
her father
porque su
or a
familia debió
grandfather
emigrar.
who has
Y
to
hoy debe
grow
escoger entre ir al mercado
three
a trabajar
grandchildren
o
because
llevarlos al
their
niño. Y
parents
esta
had
no
to
es una
be
excepción,
raised,
es la
and now
realidad
he
de
has to
muchos.
choose whether
La
going to
relación
work
entre
or
inseguridad
taking them to
alimentaria,
school.
hambre y
And
salud
this is something
mental
very
genera
frequent.
cambios
So,
importantes como
mental
apatía en el
health,
momento de decidir
hunger,
tratamientos
and
médicos o nutricionales,
food
lo que
health,
conlleva al abandono de
it's
los
a
mismos.
triad very important,
Desesperanza o
which
desconfianza al momento de pedir ayuda
may lead
y
to
también en la población
hopeless,
infantil,
a sense of
afectaciones del
hopeless,
desarrollo
and
cognitivo
also
que
in
muchas
young
veces son
populations it
irreversibles.
affects
¿Y cuáles son las
cognitive
dificultades
development,
que han
things that
identificado
may
con las
be
personas cuidadoras?
non-reversible.
Estos
Which
cuidadores,
difficulties
mayormente
have been
mujeres,
identified
enfrentan
with
situaciones
caregivers?
como
These
carga laboral
caregivers,
invisible en la
mostly
que deben
women,
cuidar a niños,
face
ancianos y
situations like the
discapacitados
invisible
mientras trabajan y cuidan de
burdens
sus
like
hogares.
taking
También
care of
enfrentan desigualdad de
elderly,
género en donde son
disabled,
las
and
mujeres
kids.
Quienes
While
deben
they
realizar
work,
estas
they
tareas
also
sin
face
quejarse,
gender
sacrificando su salud
inequalities.
y
They
sus
have to
oportunidades de
perform
desarrollo.
these tasks
Y también
without
barreras emocionales en
complaining,
el cual el estigma la
and
silencia.
also emotional
Frente a esto,
barrier
creamos un
where
modelo que integra salud
stigma
mental en
makes them
nutrición,
silence.
mediante un
So,
protocolo
nutrition and
operativo
mental
de salud
health
mental y apoyo
integrated
psicosocial en
in this
recuperación
protocol
nutricional.
by
Este protocolo
psychosocial
incluye
and
diferentes
nutritional
actividades como
support. This
realizar
protocol
sensibilizaciones,
includes
espacios
different
de promoción de
activities like
bienestar, consultorías
organizations in
personalizadas, tanto individuales como familiares, y grupos de
individualized
seguimiento nutricional y
consultancy,
apoyo.
proper
El objetivo de
spaces for
estos
support,
espacios es favorecer
nutritional
el
follow-up,
bienestar
and
emocional de las
support in
personas
general.
y
These
promover
aim at
mejoras en su situación de
benefiting
vida. Esto lo
mental health
realizamos
and
mediante
improving
espacios
their
que
living
contribuyan a la
conditions.
identificación
We do
de fallas
this
o
by means
dificultades para
of
lograr la adherencia al tratamiento,
addressing
promover espacios
all
de
the
cuidado
aspects that lead
sensible,
to the lack of
promover
treatment,
espacios que
to
contribuyan
foster
a mejorar la
sensitive care
estimulación temprana
spaces and spaces
y
that can help
habilidades para la
to
vida que
early
permitan favorecer los
stimulation,
procesos de resiliencia.
daily
Y
life
Reisa, ¿cómo
skills and
impacta esto a nuestros
abilities to
beneficiarios?
reinforce processes.
Estamos trabajando en
Does this
documentar
impact
evidencia
our
concreta que nos
beneficiaries? We
permita
are
valorar
working on a
el impacto de las
documentary
intervenciones de
with
salud mental
concrete
en nutrición.
evidence to assess the
Específicamente hemos
impact
incorporado
of
una serie de
mental
instrumentos que
health
nos brindan
initiative in
información y nos
nutrition.
permiten
We have
tener una
incorporated
estimación
tools that
respecto a esto.
that
La
give
idea es
us
poder no
information
solo
and let
documentar,
us
sino poder
make
mejorar en nuestros
estimations. We
aprendizajes
want to
y
document and we
favorecer de
want to
esta forma
improve
el
in our
impacto de nuestras
learning
intervenciones.
so as
Hasta
to
ahora, un
favor the
80% de las
impact of
personas que
our
atendemos
interventions.
han
So far,
reportado una percepción
80% of
de
the
mejora
people
de
we
su
have
sensación de bienestar.
registered
Y a
have
nivel
reported an
cualitativo, un
improvement in what they
85% de
feel
las
as for
personas
well-being.
ha manifestado una
5%
sensación
of
de
the people
recuperación
receiving three
nutricional
interventions have
que
said
de cierta
that they
forma está
recovered
relacionado
nutritionally,
con el
which
reporte
in
de
certain way
recuperación
is
nutricional
related
real que
to the
75%
report of
dentro de nuestros
actual
programas nutricionales.
nutrition recovery, which is 75%. This impact mirrors on what our beneficiaries said. There are some quotes here related to improvement appetite and telling what made the difference. Also, someone says that healthy food is much more than just having the 4 meals a day. It has to be a good experience so that well-being is attained and weight is increased. So nutrition and mental health is a lifesaver and it gives us strength to continue fighting. It has been proven by experience to be effective. We attain healthy
Gracias a
and
ustedes por habernos
complete
acompañado en este
recovery
espacio
that
y gracias a ti,
empowers
Reisa, por
and
estar conmigo el día de hoy.
relaxes.
Muchas gracias a
Thanks
todos por
for
el
you for being here, and thank you, Reisa, for being here with me today. Thank you all for this opportunity.
We will have another 6 minutes of break, so you can either join the networking session in one of the breakout rooms or look at the posters in one of the breakout rooms. We will start the next session in 6 minutes. Thank you.
Sí, nos quedarían 60, 80 minutos. ¿Hacemos 20, 20, 20, 20, querés? ¿20 cada una?
Welcome back, colleagues. Now we're heading to the session 13. For this session, we're talking about the global nutrition cluster strategy development. Where have we been and where are we going? For this presentation, we will have Alexa Humphreys, is the GNC strategy development consultant. She brings to this role a decade of multi-regional experience in humanitarian nutrition, with a focus on localization, assessment, research, and capacity strengthening. She's passionate about translating complex concepts into and data into action. So over to you, Alexa.
Thank you, Ruben. Can you hear and see me?
We can hear you, but we won't see you.
Strange. Okay. Maybe something's going on with my camera. Colleagues, I'll just proceed. One other thing, is there
Alexa, we are not able to hear you. Did we lose you?
Sorry, colleagues, can you hear me and see me now?
Yes, we can hear and see you.
Okay,
Take it
great.
away.
Sorry about that. Getting right back into it. So, colleagues, my name is Alexa or Alexander Humphreys. I am joining you today in my capacity as the GNC Strategy Development Consultant. Very happy to be with you for this final session of this excellent event where we're going to be looking at a bit of the history of the GNC, what has driven us to where we are today, and get some of your excellent ideas on where we are going. This session is going to include an overview of the GNC strategy development process. We're going to look at the aim of the next strategy. Going to look at some guiding principles, discuss how we can improve our vision and mission, and we're also going to have some group work on strategic objectives. The process for developing the next iteration of the GNC strategy is a long but thoughtful one. We started with a formative workshop with the GNC Strategic Advisory Group to set us on our course at the end of last year. We then had a process of defining our methodology, conducting key informant interviews, and writing an inception report to clarify our approach. We are now wrapping up the end of the consultative period, which included a stakeholder survey, drop-in sessions, and even this GNC Global event in this session. And this was really important to be able to hear from the GNC collective and generate ideas. And this entire process is basically following an approach of idea generation, synthesizing those ideas, building consensus, refining, and validation. Next step, a little bit later in the year, is going to be, well, the next step, Q3 of this year, is going to be developing an outline, a proposed outline for the next strategy, then developing the strategy itself, and then we're looking at validation and launch the beginning of next year. I wanted to take us through a bit of a journey today. I think it can be relevant and interesting to look at where we're coming from to help inform where we're going. So I just wanted to appreciate for a moment the different strategic documents that have guided the GNC over time. We started in 2010 with a strategic framework. There may have been other documents before this, but this is the first one I'm aware of. It was a one-page framework with 6 strategic areas. It was adapted for 2011 to 2013 to have 4 strategic areas. 2014 to 2016, we had a strategic plan with 4 strategic pillars, and it was 11 pages. 2017 to 2020, we had our first GNC strategy. It was 4 years and 23 pages with 3 strategic priorities. And then our current strategy is from 2022 to this year. It's a 4-year strategy with 3 strategic objectives and 41 pages. You will note that our strategic documents have evolved over time, and they've also increased in page length over time. The aim of the next strategy is going to be creating something that can be our North Star, something that is anchored in our principles, and that's going to guide us through the challenging times ahead. I heard a great analogy for the current environment that we're in, an analogy about going on a journey. And in recent years, we've had a pretty steady environment that we're traversing through. And now we find ourselves at the bottom of a hill or a mountain of humanitarian need and challenges that are before us. So developing a strategy right now is a bit like deciding what is important to us, what is essential, what are the values that will guide us, what are the tools we're going to carry with us because we need to travel lighter and more efficiently, and who's going to walk this path with us. So these are some of the kinds of questions that we are going to ask our next strategy to answer for us and to help guide us through the challenging terrain ahead. Just so you know, during the session, there's going to be a number of interactive polls. We're going to be using Menti quite a lot. This can be accessed using your phone or your laptop. Just go to menti.com, MENTI.com, and use the code at the top of the screen. This first question is not to inform the strategy. It's just to get a sense of how you as an individual or as an organization engage with the GNC. So I apologize, this slide looks a little messy because of all the text, but when you go in to answer this poll in your phone or your computer, you're going to see the responses or the options are pretty clear. They are in all languages so everyone can access them. And you're allowed to select more than one. Feel free to start entering your responses about how or in what ways you engage with the GNC. So this can be as a donor, as someone who's part of the GNC team, as someone who is a global partner or observer. Some of these categories I consolidated to make them a little bit smaller to try to fit them into this poll. You might also be a co-chair or a member of a working group under the GNC. You might be a team member of a nutrition cluster in country. You might be a nutrition partner of a cluster in country. You may also be a local or national partner in country. That's an option as well. You might be part of the Sun Civil Society or their regional networks or their country networks. You might be a regional actor, a regional focal point. And you also could be someone who really loves attending our online events, and that's how you tend to engage with us most. So I'm going to give a couple more minutes. Feel free to go to menti.com, use the code at the top of the screen, 5738-9963. And this is just to give a sense of who's in the room. What way do you normally, or ways, you can select more than one, do you normally engage with the GNC? I'm going to leave this open for about 30 more seconds. See a lot of engagement from folks that are part of the working groups. A number of individuals, we have about 18% right now who engage with us via our webinars or different online events. About 14% that are part of the GNC team or our GNC partner or observer. We have definitely some country representation. Not seeing any representation at the moment from donors, local or national partners. Oh, yay, there's a local and national partner. Great. So far, not seeing any representation from donors, regional focal points, or Sun Civil Society, but no worries. Thank you for waiting on for this poll. This was sort of to get us warmed up. There will be more polls during this process. Now, something that's going to be, I keep hearing over and over again, it's going to be very important for this specific strategy is that we are anchored in our principles. And so we're going to have a bit of a review of what have principles looked like for the GNC until now, and what are some principles that we would like to see guide the GNC into the future. So first of all, I think it's always helpful to have some framing. So what are values and what are principles? Values are basically beliefs or ideals. They indicate what is important to us, and they can be something that we individually hold as a value, or they can be something that a group or an entity or an organization holds as a value. It's important to them. Principles are more like fundamental truths or rules, and they help us translate values into action. They tend to be something that we articulate and we stand by. In terms of what values and principles have looked like for the GNC over time, we did have a section, and please keep in mind this is in addition to the humanitarian principles. The GNC will always be supporting and standing by the humanitarian principles. But in addition to those, there have been some principles or values that we have articulated in our different documents over time that reflect what is important to us. So, for example, the GNC strategy from 2017 to 2020, principles that were articulated in that document, I've summarized them a bit here, but adhering to sphere standards was really important at that time. Prioritizing support to maximize our value add was articulated. Being open about learning from both our successes and our failures was articulated as something that was important to the GNC. And also developing partnerships. Then it's interesting because we currently don't articulate the principles in our current GNC strategy, the 2022 to 2025, but we want to make sure that those are very front and center, they're very elevated in the next strategy. But what we do have right now is the GNC SOP that was developed in 2021 does articulate 4 different principles. One is around building capacity. One is around commitment and voluntary cooperation. One is around supporting national authorities, supporting their priorities and their efforts. And then there is again another principle around partnerships. So partnerships is the one I noticed from these 2 past relevant documents for the GNC, where they are both partnerships are highlighted in both and they're valued in both. So now here's another poll. It's using the same menti.com platform, and it's actually the same code. It's at the top of the screen. Would love to hear from you. In addition to the humanitarian principles, what other principles or values do you think should guide the GNC into the future? Feel free to write in any language. This is all going to be useful and be analyzed and synthesized later. So feel free to enter in any language and let us know what, in addition to the humanitarian principles, what else should we be highlighting? Give everyone a moment to enter that in. And if anyone is having problems with Menti, feel free to put your thoughts in the chat. That's also going to be documented and valuable for later. So seeing some responses coming in. Human rights, equality, trust. Focusing on most vulnerable populations. Great. Focus on supremacy. Okay, so we have two that are kind of reinforcing around supporting the most vulnerable populations. Evidence-based, gender transformative, cultural adaptation, reliability, community-centered. I'm seeing some intersectorality, integrity, accountability. Great. Community focus, more around community. AAP, great. Collaboration, partnership, do no harm. Do no harm is an interesting principle because it originally comes, I believe, from the from healthcare, but we oftentimes reference it and support it as well in our sector. Accountability, focus on humanitarian crisis and not fragile context at large, more around community-centered, cultural and local contexts, integration with other sectors. All right, I'm going to keep this poll open for just maybe one more minute. Keep your ideas coming. If I do shift and you didn't have time to enter your responses, you can also put them in the chat. That is absolutely fine. Synergies, respect to lived experiences, efficiency. Great. These are great ideas. And feel free to suggest multiple ideas. That is also very welcome. Other around community, research, learning-based approaches, adaptability. Okay, I'm going to give us about 30 more seconds. Any other ideas, any additional principles or values that you would like to see guide the GNC in the future to help guide us through the challenging terrain ahead? Flexibility, especially from donors. Great, okay. Sorry, I'm moving on, but again, if I'm too fast, your ideas in the chat will be really appreciated as well. Okay. So now we're going to spend a little time looking at the vision and mission. Where we come from, where are we going? You're probably noticing a theme of this session. So first things first, what is a vision? A vision tends to be a written declaration. It tends to be something that is quite future-looking, broad, long-term, almost so aspirational it feels unattainable because a vision should be really big. It should be very aspirational, but it also needs to be concise. So it shouldn't be longer than a sentence or two. Ideally, when you have a well-constructed vision, it's something that everyone in your organization can easily remember and easily repeat. They should be able to say it to someone in passing. But it should also be inspirational and clear. We're going to look at some examples of partner visions. And maybe actually just before I move on, visions are future-based to inspire, whereas mission statements are based in the present. They're explaining our why and how we contribute to that broader vision. Sometimes there can be confusion between vision and mission, so I think it's helpful to have that framing. Okay. we're going to look briefly at some partner examples. I pulled 4 examples from GNC partners that were, I personally found these to be great examples of vision based on the parameters that I mentioned before. So Action Against Hunger Canada, their vision is a world free from hunger. Concern Worldwide is to end extreme poverty, whatever it takes. Save the Children's vision is to create a world where every child has the right to survival, protection, development, and participation. And UNICEF, the example is to build a better world for every child. You're probably noticing that these all tend to be very concise, very aspirational, and very big thinking, big ideas. The GNC vision over time, I thought it was useful to look at the past 3 iterations of our vision, or our current and the past 2. For our strategic plan in 2014-2016, the vision of the GNC was to safeguard and improve the nutritional status of emergency affected populations. So that language around safeguard and improve. The vision for the last strategy, 2017 to 2020, it was a vision to look, it was really focused on the Sustainable Development Goal 2.2 and how we could contribute to that specifically. And then for our current strategy, it's just shaped a bit differently. There's a timeline, and we mentioned the nutrition status of the most vulnerable. And then we mentioned the kind of countries that we would support. So this has been our vision over time and sort of how it's evolved. But I want us to, we're going to do something collaborative and think about what would be a good way to shape our vision. But I want us to keep in mind the partner examples that we looked at and the sort of framing for what makes a good vision. So in your opinion, this is another Menti poll using samementi.com, using the same code. In your opinion, how can we improve the current vision of the GNC? The current vision of the GNC reads, by the end of 2025, the nutritional status of the most vulnerable people is protected in countries at risk of or with ongoing situations of fragility. And I apologize, I could only fit 1 language onto this slide, so I'm just going to repeat it 1 more time for the interpreters. In your opinion, how can we improve the vision of the GNC? So the current GNC, I really appreciate that first comment. The current GNC vision is by the end of 2025, the nutritional status of the most vulnerable people is protected in countries at risk of or with ongoing situations of fragility. Ooh, some great ideas already coming in. Make it shorter and attainable. I like that. Remove the time frame. I tend to agree with that. Reflect the humanitarian reset. That's a really interesting suggestion. Need to think about what that would look like. But I do think just generally, we want to ensure our strategy in many different components of the strategy is aligned with the humanitarian reset. We want to be responsive and reflecting the results of the humanitarian reset and contributing to it. Be more specific in the vision of the GNC. How can measure? Yes, remove the time frame. I think we want to reach vulnerable people anywhere. We have a rephrased yeah, I think it's just somewhat rephrased or submitted idea for a vision by 2030 to ensure sustainable nutrition outcomes for the most vulnerable, fostering resilient and rights-based systems in fragile and crisis-affected contexts. I like this, but I know there was the other comment about taking out the time frame. Generally, visions don't include time frames, so we might want to think about adjusting that. And feel free, colleagues, I see descriptions of what to change. If you have ideas for what could be a good vision, also please submit that. Like if you think, I think the vision should be this, and it's completely different than our current vision, feel free to put that in the chat as well. It's very interesting. But yeah, comments about we should revise it completely. I've heard that before in conversations that we should start from scratch. Playing with SDGs. Be more specific. Consider our mandate. Focus, focus, focus. Reflect the humanitarian reset. We've seen that again. Specify kinds of countries. We could think about that. Okay. Oh, here's a recommendation. By 2025, the GNC envisions a world where the nutritional status of the most vulnerable is safeguarded through inclusive, accountable, and locally driven responses in contexts of fragility. Nice. There's some really nice components there. Align with humanitarian principles. Add focus on improving or sustaining nutritional status, not just protecting it. I really appreciate this. This could be the same person that fed into the stakeholder survey, or it could be a different person with the same idea, but we have had some suggestions for changing it from protecting or sustaining to improving nutritional status, and this does reflect an earlier version of the GNC vision. Align with development goals. Refocus to humanitarian, too lofty. I think this comes back to focus, 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 and focus on our mandate. Protecting status sounds paternalistic. I think that's going to be an important. Yeah, thank you for that suggestion. That's important that we're being thoughtful about power dynamics in everything that we are doing. Use more action-oriented language. Make it feel more dynamic. Yep. Nutritional status is protected, isn't tangible or trackable. Great. Okay, colleagues. I'm going to give us just about 30 more seconds on this. Again, if you missed the poll, put it in the chat. It's still going to be valuable. Suggestion: the GNC supports the achievement of a world free from all forms of malnutrition. Yeah, I really like that one. It's not about me, it's about the collective, but I think that's a great suggestion. Consult expert in developing visions. Yeah, happy to. We still have scope to do some additional key informant interviews. Really happy to consult with an expert on developing visions. Great. Okay, colleagues, going to move on to the next piece now. This is going to be a similar approach to how we looked at the vision. We're also going to look at the mission. In short, a mission is a brief statement that explains an organization's purpose, objectives, and how it will achieve them. Missions are based in the present. They're not forward and future looking like the vision. They're looking at what are we now? What are we here? What is our raison d'être? What is our reason for being as an organization? And very importantly, how are we contributing? What is our piece that contributes to achieving that overall mission? We're not going to achieve the overall mission, but we're going to be a part of that. And there are going to be others that walk along with us that help us achieve that or move towards that. Some partner examples of missions include Action Against Hunger UK to save lives by preventing, detecting, and treating malnutrition, especially during and after emergencies. IMC's mission is to improve the quality of life through health interventions and related activities that strengthen underserved communities worldwide. UNICEF's mission is to protect children's rights, help meet their basic needs, and expand their opportunities to reach their full potential. So I think we can see here, these tend to be just a little bit longer than the vision, but still concise. And they explain what is that agency or organization, what is it that they're contributing to that vision. In terms of the GNC's mission and how it's evolved over time, in our 2014 to 2016 strategic plan, We refer to it as our core purpose. I'm referencing, in my opinion, this is equivalent to a mission. And it was really around enabling coordination mechanisms to be able to support timely, quality, and appropriate response. And then supporting these country coordination mechanisms with these many different aspects, such as decision-making and strategy development, advocacy, et cetera. In the GNC Strategy 2017-2020, we talk about the GNC Collective, and we talk about why we exist, and we mention safeguarding and improving the nutritional status of crisis-affected populations. And then we also talk about enabling coordination mechanisms to achieve, this a robust response. And then our current mission and our current strategy mentions, it adds on the capacity strengthening piece. And it also mentions something else that's different from the other missions. It mentions forecasting nutrition trends and shocks to the nutrition situation. So this is just to give a sense, how has our mission evolved over time? Again, to give us a bit of an idea, looking at partner examples and looking at a general framing of what a mission should be, and then looking at how ours has evolved, what would we like to see for the next iteration of the GNC mission? So I think this is our last Menti poll. Please add your suggestions. This Menti poll reads, in your opinion, how can we improve the mission of the GNC? And we just saw the GNC mission on the last slide, but I'm going to read it out for the benefit of the interpreters. The current GNC mission reads, the GNC exists to collectively strengthen the technical and coordination capacities for nutrition in countries based on the needs of affected populations. This is to enable countries to forecast nutrition trends and prepare for, respond to, and recover from shocks to the nutrition situation, thereby contributing to global efforts to prevent and treat malnutrition in all its forms. So please, please send through your suggestions. If you can't put them here in the Menti, I'm not able to see the chat at the moment, but please put them in the chat and they are going to be, others can see them and we'll make sure that we are synthesizing them with the other results of this event. So now, some suggestions here. Focus on what the collective can build and decentralize for a global group of experts. Decentralization, interesting. Summarize it to be further short. Yep, so let's make it a little briefer. I agree with that. Some suggestions here. Oh, sorry, moving so quickly. There was something about catalyzing. We'll have to go back to that one. It's okay. Work on being more concise. Yes. Strengthening communities and local authorities and organizations. Excellent. Needs a bit of wordsmithing to make it more readable, especially the second sentence. Great. Include resource mobilization. Comment that it reads more like an operational objective than a clear, motivating mission statement. I mentioned a lot, vision should be motivating, but also our mission should be motivating, and it should be very personal to the work that we do. Empower communities. Maintain clarity on the GNC's core coordination role. Make it more concise. Great, great, great. I agree that the first sentence is better. The second one is too detailed. Okay. Seeing some similarities in terms of, the great suggestions to make everything a bit more concise, more action oriented, easier to recall. I think it's great. I think it's a very feasible goal to have the vision be something we could easily memorize, but I think the same can be said for a mission. At least that the main point of the mission should be easily conveyable. Expand beyond countries to include local actors and communities. Focuses heavily on capacities and systems, less on people and outcomes. Yes, we will make sure that when we update it, it will be in the next iteration of the strategy. concept of excellence, humanitarian reset, localization, explicitly include advocacy, local leadership and resource mobilization, promote the engagement of government or local authority, something more empowering. Appreciate that. I think we do want this to be empowering. So anyone that is part of the GNC or the GNC collective should find it empowering. I appreciate that. Make it shorter, decentralization, localization, marginalized groups, ensure they're reached. Okay, colleagues, I'm just going to give us about 30 more seconds with this poll. Again, if I'm too quick for you, please add your comments in the chat. They'll still be valuable and appreciated. Okay, gonna move on because I think the movements have stopped. Thank you for those who are putting the thumbs up in the chat. I appreciate it. Nice and encouraging. In terms of strategic objectives, this is a very messy slide, so I'm just going to walk us through it. But I personally found it interesting to zoom in and look at what are the different strategic areas that the GNC has focused on over time. We had the earlier slide that looked at the strategic documents that have guided us over time. These are pulling the strategic areas out of each of those. So in 2010, we had the most ever strategic areas from across these documents. Some of them, coordination, advocacy, and resource mobilization has always been essential and is something that's continued across all strategic documents, even if it's taken slightly different forms, or even kind of split into different strategic areas. In 2010, we had a strategic objective around policy, standards, and guidelines, which was carried over to the next 2011, 2013. And that has seemed to sort of kind of merge into other strategic objectives. Capacity strengthening has taken different forms and sort of moved around the different strategic areas as well. But capacity strengthening has always been a part of at least one of our strategic objectives. We had standalone objective around preparedness back in 2010, which was then fell under strategic area 3 in 2011, 2013. And this probably the current strategy that we have has some of the most interesting objectives in terms of what's included in them and how we summarize them. I know strategic objective 1 in my conversations with many different members of the collective, having that objective around people, the right people in the right place with the right skill sets, is something that I think people really appreciate, and it's something that just feels it is a bit inspiring and easy to reiterate. The other ones are quite valuable as well, but there's still, I think it's interesting and valuable to look at again where we've come from and where we're going, even in terms of strategic objectives. So as we've been doing throughout this session, trying to be very interactive and gathering as many of your insights as possible, what we're going to do now is move into group work. I know some people really enjoy group work and some people don't. We're not going to force anyone, but we do have 7 rooms that are available for different groups. The 7 different groups, or 7 different rooms, are going to have sort of 7 different objectives. Room 4 is going to look at the strategic objective 1 on people. And sorry, before I go into the details, you're going to self-select which room you would like to be a part of and a part of the conversation. There is going to be a note taker in each room there just to take down your notes and great ideas. So don't feel pressure that you need to write. With the exception of group 1, I apologize, group 1, I don't have a note taker. So if anyone who's in the room could volunteer as a note taker, it'd be really appreciated. And there's going to be a slide deck and a single slide for each room. Note takers will support with that. And we're just going to be asking for your ideas and suggestions. Back to the rooms. Rooms 4 through 7 are English because we do have more English speaking participants as a part of the event today, is my estimation. So room 4 is going to be looking at strategic objective 1, people, the current GNC strategic objective. You are welcome to suggest how to improve this or completely rewrite it. It's up to you. Room 5 is strategic objective 2. Room 6 is our strategic objective 3. Room 7 is completely open ideas brainstorming. If you have an idea for a different strategic objective that we don't currently have, or something you think is relevant for us to consider as a strategic objective, room 7 is your room. Now, for the other language rooms, room 1 is Arabic, room 2 is French, room 3 is Spanish. You are going to be looking across all of the different strategic objectives, the 3, and also have space to suggest new ideas. I hope the instructions make sense. Please, everyone, self-select the rooms you would like to go to. And I'm just realizing now, if someone from the team can put the link to the slides for the group work into the chat, I just want to make sure whoever's in the Arabic room has access to that before they enter the room, or we can pop in and make sure you have that link. So colleagues, inviting everyone to enter the rooms. Dear kind volunteer note takers, please also go to your assigned rooms. And again, this is a space for open discussion. All of your ideas and suggestions are welcome and will be documented. Okay, welcome back, colleagues, as we're filtering back into plenary. It's great to see so much activity in the rooms. It seems like strategic objective 2, operational and technical support, was an especially exciting room for conversation. Lots of inputs I'm expecting from there. I'm going to basically wrap up my session. Want to say thank you very much, everyone, for your engagement, interacting in the polls, writing in the chat, joining the breakout rooms. This is all really important insights, reflecting the wishes of the collective that will be taken into consideration through the strategy development process. I think in order to be kind and save a couple minutes, even finish this session a couple minutes early, I'm just going to ask if there was anything interesting that stood out in any of the rooms that you'd like to share. Please just put them in the chat. It could be interesting for other colleagues who weren't in those rooms to hear about some highlights. But thank you so much to the note takers that were in the room. All the notes you took will be reviewed and synthesized and will be very helpful. Yes, so go ahead and write any highlights for you from the breakout rooms in the chat. Otherwise, just want to say thank you again. It's going to be quite a task developing a strategy that is going to suit us for the next 4 or 5 years, because there are a lot of changes afoot, but we look forward to the challenge. And again, all of your insights are incredibly valuable in this process. So thank you, everyone, and handing back over to Iris and Ruben. Thank you.
Great. Thank you so much, Alexa. I really enjoyed this interactive session. I think it's the most interactive session we had today. So thank you so much for including the feedback of all the participants. This was the last session of our day, and actually the last session of the global event. But obviously we cannot say goodbye without any closing remarks. So we will go over to the closing remarks now, and we would have closing remarks from both Stefano and from Andrew. I don't think they need a full introduction, but I will give it anyway for those who don't know Stefano or Andrew. So Stefano has been the Global Nutrition Cluster Coordinator for over 5 years. And prior to this current posting, Stefano was the Regional Nutrition Specialist for the UNICEF Regional Office for Latin America and the Caribbean. He's also been a nutrition cluster coordinator in Haiti, and he has worked in various emergency operations in Asia and Africa with WFP, UNICEF, and UNHCR. Andrew is a senior public health and nutrition advisor with over 17 years of experience in humanitarian response and health system leadership. He is the co-lead of the Global Nutrition Cluster team with Save the Children International, and he has worked with UNICEF, ICRC, and MSF. And his work focuses on locally led solutions, decolonialized practices, and integrated public health programming. So Stefano and Andrew, over to you, please, for the closing remarks.
Thanks, Iris. Stefano, do you want to go first or second?
No, please go ahead, Andrew.
Okay, great. Thank you, everyone. And then just one point of clarification. Save the Children is the Global Nutrition Cluster's co-lead for the program team as well. So thank you, everyone. So I'd just like to thank everyone for their energy, your insights, and your unwavering commitment over the last 3 days. The event doesn't end today. We've got some side events on capacity strengthening on Monday, and we have a GNC update call on Thursday, both in next week. And hopefully Marie is able to pop the links into the chat for everyone to register to carry on this really important conversation into next week as well. I'd like to take the opportunity to thank everyone involved in organizing the event and the donors who have made this event possible. But it also wouldn't be possible without all the amazing speakers, moderators, presentations, and posters. The time and commitment from everyone has been amazing in the build-up and over the last 3 days. I'm feeling energized and hopeful despite the nutrition crisis and all the changes we're going through. It's been a really powerful reminder that this is more than a technical event. It's a collective reaffirmation of why we do this work, to ensure that every child, everywhere, can survive, grow, and thrive. We've been challenged to think differently, not only about what we do in nutrition, but how we do it, who leads it, and what system sustains it. There were 3 themes based on our strategic objectives running through this year's agenda: people, technical support, and enabling environments. And this has given us the structure and the momentum we need to drive real change. And I'm quickly just going to reflect on those 3 days through that. So, people. Throughout the event, the message was clear. People are the foundation of an effective nutrition system. We saw extraordinary examples of leadership from national governments taking ownership of coordination platforms, to local and national actors and community workers shaping context-specific responses, to global partners showing flexibility and support. We also broadened our understanding of community. It's not just a delivery channel. It's a diverse and dynamic space made up of caregivers, youth groups, youth advocates, women's associations, health workers, local leaders, and informal networks. These communities are not just participating, they are co-creating nutrition solutions, and they must remain central and build to how we move forwards. We must continue to invest in people. Our second theme was around the technical support, driven by evidence and adapted to the context. On the second theme, we saw how essential it is for our interventions to be evidence-based, adaptive, and responsive, from maternal nutrition and adolescent health to IYCFE, MAMI, micronutrient supplementation, early detection tools, and social behavior change. We have a growing toolbox of proven approaches, but more importantly, we heard how these need to be contextualized and delivered not in isolation, but in a coordinated, multi-sectoral manner. We cannot allow nutrition emergencies to be reduced to just treatment. This includes addressing the growing need for nutrition emergencies to be integrated across health, food, wash, education, and protection. especially as crises become more protracted and climate-related shocks more frequently. And the third theme we picked upon was the enabling environments. And we cannot scale what we cannot fund. We heard clearly that financing remains a bottleneck, especially to local and national actors. 6-month project cycles are not supporting the system change that we need. We cannot fund the prevention, preparedness, and the scale up in an integrated way without better finance. But enabling environments go beyond money. They include strong governance, clear policies, and aligned monitoring systems, and coordination platforms that bring all stakeholders to the table, including communities themselves. We heard really strong progress in our commitments around decolonization and how to continue to invest in local and national actors. And we spent some time discussing these themes to think about how we take them into our strategy in the next few years. And through all of these 3 strategic areas, the theme that came out and that emerged as central and time again was community, and rightly so. But it's also clear that community means many things. It means the caregivers doing the MUAC at home, the volunteers collecting data, the local NGOs designing services, the health workers serving remote villages, and even the networks of practice we've built together at the GNC at the global level. Communities are where our thoughts become reality, and they are where sustainability starts. If we want to transition from external programming to nationally owned systems over the next 4 years, we must build around community ownership, not just community participation. This is also true at the global level. The GNC needs community and everyone on this call to continue to support, own, and contribute to a shared collective future. It's been amazing the last 3 days, and I'd just like to take the chance to thank Stefano and the whole team at the GNC and at UNICEF for their outstanding leadership to the Global Nutrition Cluster. Your commitment to inclusive coordination, technical excellence, and principled humanitarian action is the backbone of our collective effort. As we move into the humanitarian reset, Save the Children, and I hope all of us are ready to work together to ensure nutrition remains central, both in emergency response and in longer-term health, education, and protection systems. The last 3 days to show we're not short of solutions. We are rich in them, and we need now is follow through, boldness, and trust in the systems and people closest to children. I take this moment to call us to forward commitment so we are built here that nutrition's everyone's responsibility every day and not just when there's a crisis. Thank you all so much for being here for the last 3 days and supporting the GNC over the last year since our last annual event, and I had the chance to make these statements. Once again, thank you very much, and over to Stefano to close us out for the day.
Thank you very much, Andrew. I hope you can hear me well. Now, thank you, Andrew, also for summarizing the key aspects of the last 3 days, which have been very, very a source of learning and really a renewed respect for the nutrition cluster, not as a coordination team at the global or national level, but really as a community of people totally dedicated to advancing nutrition and preventing and treating malnutrition and in all its forms, and ideally in all contexts that are subject to vulnerability. Now, the yearly GNC global event is not just a meeting. It's a space to listen, to learn, and to challenge each other. And it's also an opportunity to reflect upon where we are, to explore what's working, and to chart a path forward that is more inclusive, more locally led, and more efficient. And I've attended several GNC global events, and I find that this one is possibly the most challenging one. Again, and that's not because of the commitment and the resourcefulness and flexibility that all the participants and partners have shown, but it's because of the challenges in the world that we are facing, which keep getting more complex, more unpredictable, and increase the damage to the people that we serve year on year. And that's very difficult for me personally, having been involved in nutrition coordination for more than 20 years, to really come to terms that close to the end of my career, our capacity to respond is actually drastically reduced. So we have heard again and again that change is coming. And as it was shared on Monday, the updates on the humanitarian reset, we have no choice but to lean into it and embrace as much of the changes as possible, while at the same time standing by the principles that have guided our action for many years. And the nutrition cluster has been, for many years, even before my arrival here in Geneva, has been really a trailblazer, has been an excellent model for other clusters, but also for other actors in humanitarian action. Now, it's really important that nutrition emergency remains central, and how we deliver it must shift to reflect the changed way of working, plugging into area-based coordination and ensuring local and national leadership through our localization agenda. But these are principles that we have already embraced, and we've already embraced for a long time. The GNC has for several years already adopted and support changes as they relate to localization and coordination as close as possible to the crisis hotspot. And if things have not always gone the way we wanted, it's certainly not because of the lack of commitment or support from the coordination teams or the partners at the national or global level. It's because of a series of limitations that we've always felt. Additionally, the reduction in funding will force us to look at the large and longer lasting impact that limited human and financial resources will have on our sectors. But we will also force us to create innovative and flexible coordination, information management, and programmatic support to face the more frequent and complex crises. And we have always, I've been involved with the cluster since 2005, since its inception. I attended the first cluster coordinator meeting here in Geneva, I remember. And what has always characterized the nutrition cluster as a community has always been ready to evolve and embrace change and shape it in the most effective and efficient way to serve even better the people that we serve. So the nutrition overall, I can say the Nutrition Collective has made incredible strides over the last 20 years and transforming how humanitarian nutrition responses are coordinated, delivered, and adapted to meet the needs of the most vulnerable in crisis. At the moment, the outlook may be gloomy, and that's for a variety of reasons. But one thing this event has shown us is that the GNC is all of us. It's not one group in Geneva or at the regional level or at the country level. And all the contributors and presentations have shown us that as a sector, we remain remarkably resilient and embrace innovation, and we really stand fast by the principles that have shaped our work. And we will continue to do so. And we will continue to show, in spite of the limited human and financial resources, we're going to make sure that we stand by those principles with coherence, consistency, and predictability. And also that we remain a holistic support platform for all partners. Our capacity to provide in-country support to some countries may be reduced, but really there is still going to be a lot of work and resources and tools and guidance, which will be applicable and useful for any partner, and in particular national authorities that want to strengthen nutrition sector coordination prior to, during, and after a crisis. But our capacity probably will mean that we will have to prioritize the highest and most urgent emergencies for specific work which require the utilization of global resources. So let's move forward, we hope, anchored in the strength and dedication of our collective, the partnership we have deepened, and the belief that even in time of reform and uncertainty, we can shape a coordination system that is more efficient, more effective, and better able to ensure nutrition is protected and prioritized in every emergency for every child, and the needs of the affected population are met, leaving no one behind. And trust me, there is going to be increasing question of whether the nutrition coordination, whatever forms you may want to call it, but ideally national-led nutrition coordination needs to be activated in a crisis, and whether nutrition is a priority or not. And I think that it is important that people in the know, who really understand how important the timely activation of a nutrition response is, that really make their voice heard at all levels, and in particular at the country level, guiding humanitarian country teams and humanitarian coordinators on prioritizing nutrition and doing so as early as possible. Now, before closing, I also want to extend our team's collected heartfelt gratitude to JSI for so expertly hosting this event and helping everything run so smoothly. And we really hope that we are going to be able to rely on their support in the future. A warm thank you also to our daily moderators, the session leads, and the main inspiring speakers who have brought ideas, energy, and experience to the discussion. And also not to mention the great timekeeping. We also thank our donors for enabling the work of the GNC and the nutrition cluster at the national level, and really to make that have really enabled us to also be one of the lead clusters for many, many years. And most importantly, thank you to each and every participant for showing up, speaking up, and making this truly a collective space. And I know that some of you have done it even while their organizations or themselves are going through important career changes. And you know, I'm deeply affected by some of these changes, and it's going to be quite challenging the months and ahead, but with your support and the wider family that I consider the GNC, we will be doing our best, as always. Thank you.
Thank you so much, Andrew and Stefano, for those speeches and remarks. And as we come to the end of day 3 and close this year GNC Global event, I want to thank all of you for your active engagement, thoughtful contributions, and dedication over the past 3 years. Across these 3 years, we stay grounded in the principles of people, technical excellence, and enabling environments. And we share real progress that we made during this strategic period. So to all of you, thank you for your participation. And of course, thank you to the technical team, as Stefano said, the GSI team, and the interpreters. Thank you for keeping us connected and inclusive across the languages and regions. So Iris, over to you.
Great. Well, thanks. And thanks, Ruben, for being my co-moderator. I really enjoyed working with you today. I won't say any other things. I think we've covered everything. I just would like to ask you to all complete the evaluation. If you are leaving this meeting, hopefully the evaluation will pop up. You've also been sent an email with evaluations of day 1 and day 2. It would be great if you can complete them. This will ensure that the next global event will be organized with your inputs. If you like things, if you didn't like it, please let us know and we will incorporate it into any next event. So with that, I think we can close 2 minutes ahead of schedule. Thank you all so much. Enjoy the rest of your day or evening, and you will hear from the GNC. There will be a report from the Global Nutrition event. It won't be ready tomorrow, so please have some patience, but it will be in the next coming weeks. Thank you all so much. Bye.